You know everyone.
Well, I know. So you assume you're gonna.
Yeah.
Couple. You know, I think one came. Sure. Yeah,
I was actually.
hesitation. That was the only thing I had to, we had to fire him and then had to go get his stuff. All I needed to know.
You think you think
They're bad.
Gosh,
the sheriff's perspective? Think it's for.
I think the big
Promise to my love.
got from
It's new. So good.
Center for the Constitution. That was a quarterly presentation and I try to go down there for that.
No.
Especially.
It's not right.
It's introduced.
Howdy.
Opinion is logging in. I'm good. How are you?
Where's Dr. Pinion on this again? Yeah, if Dr. Pinion logs in, yeah. You never know.
All right, so I'm gonna step in and take over for Sheriff Rowe today. And I'll just let you guys know a couple of housekeeping things. First, I'll say welcome to our office. This is a meeting space that we put together for our members. They use it quite a lot. Hope it's a comfortable space for everybody. If you guys need anything, there's drinks and snacks and stuff in the fridge, in the kitchen, so help yourself. So a little bit for the online housekeeping piece. So we set up a table over here for public testimony, which we'll take it on the agenda. And the reason that the table is set up over there for that is because there's a camera in the ceiling that will capture that for everyone that's on virtually. So when we do public testimony, we'll ask the folks here to testify to sit at that table up there. Tara Brown on our staff helps keep all of this running in order, and she does a fabulous job for us. So if you need anything or if you have any questions, don't hesitate. And of course, Jamie and Aaron are both on our team as well. So we can help you navigate. And if you've got any questions, don't hesitate. Oh, thank you, Tara, so much. Yes. So you guys have these little microphones. The inclination is usually to grab it and bring it really close to you because that's what you typically do, but you don't have to do that with these. So if you hit the button, the green light will come on and then you can just talk. You don't have to have it right in front of you. And if you bring it too close to you, it'll be really loud. So we also have a microphone in the ceiling. So I'm hoping that folks that are online will be able to hear us pretty well, but do let us know if you have any trouble with that. Okay, so we have a quorum, I'm told. So I think we'll call the meeting to order.
Because they're not seeing the sheriff out and about, they're not seeing the staff out and about. You know, in metropolitan areas, they're running jail.
Somebody online, your microphone is on? Okay, great. I think we just muted that. All right, thank you. All right. Oh, it's back. I don't think so. If it comes back on, maybe they are trying to see them too. Sorry, yeah. I know, use it again, no. There is opportunity for public comment, I promise. We'll get there. All right, so welcome, everybody. We'll start with our roll call. I'm gonna take that over. Richard, you got it?
Sheriff Rowe. Dr. Fagan Bob.
Present.
Ann McGonigal. Colin Grissom. Emily Eisenman.
Online.
Present.
Campfire.
President.
Sonia Burns.
Present.
Dr. Pinion.
Present.
Nicole Hawk.
Present.
Sheriff Wills.
That was him we mooted, so.
Sheriff Stallman. Alan Bauman. And Lee Johnson.
Here.
You have four.
Thank you, Richard. Appreciate that. All right, so let's see. The next item is the reading and approval of minutes for the meeting conducted January 7th, 2025. Ricky, you gonna take that? We're gonna go through the minutes. Do we need to do that? I think everybody's got the minutes.
Yeah, we just normally ask if there's anything else. And it's okay with everybody that read over, if they make any changes, or not, we take a motion to approve the minutes.
We didn't include Chris on the, was that correct?
Yes, that was corrected yesterday.
Oh, it was.
What was that, Sonia?
Uh,
Was it something in the minutes?
had given.
The copy you have in front of you should have it correct.
Okay.
There was a public comment left out in the meeting, minutes that were sent to you.
Oh.
Corrected yesterday.
Perfect.
Added to this one that you have in front of you.
Okay, great. And I will remind everybody, I know it's kind of a small room, but so people can hear you online when you speak, do try and hit that button. Any other additions or corrections to the minutes? If not, I'll entertain a motion to approve the minutes. Do you have a motion?
I move minutes be approved.
Thank you, sir. Is there a second?
A second.
Thank you, Brian. All right, all those in favor? Vote by the usual sign. Aye, okay. Minutes are approved. Okay, so let's go to public comment as the next item on the agenda. Do we have folks signed up?
Oh,
Give us just a minute. We're getting a list of folks together here.
People are online. Is there an AI to do the transcript or anything?
So this is the Teams setup. It's not our setup, so I don't know. Richard might know, but I don't know.
Comment.
AI.
One that I have, but there's not one built in, at least as far as I know.
So has that been true?
Yeah, I transferred it again.
How do we know?
It's the only since I've been on
they usually put something in comments or raise their hand.
We have a commissioner on. Go first. Jerry, that's what I.
Sure. Good job.
Take this over.
Okay, just because I.
Yeah, no worries.
Where the Ellen sit? These places here.
Get another chair if we need to. Okay, y'all, we're getting close to starting public testimony here. Bear with us. I think we've got some folks online as well. I was just advised that Commissioner Simmons, I think you're on the line, and perhaps we'll start public testimony with you. So if you're ready, please begin.
Yes, good morning. Good morning to the Texas Commission on Jail Standards IDD Advisory Committee. I'm Elisa Simmons. I'm Tarrant County Commissioner here in Precinct 2. I have a vested interest in solutions, and I wanted to stop by today just to say that, because in my first term in office, I've become intimately close with two families here in Tarrant County, and there are lots more, but two families who knew to reach out to a county commissioner about their IDD loved ones in our county jail, a place that they should not have been. So I come to today to say I am interested in solutions because these aren't just numbers. They are lives being lost in some cases. We are here because when a person with intellectual or developmental disabilities enter crisis, not just in Tarrant County, but in counties across the state, the public record still looks like a patchwork instead of a clear system. For a psychiatric emergency plan lists men's, women's, and adolescent crisis respite units, but those are on the behavioral health side. And the listed units do not accept emergency detentions. On the IDD side, public materials describe crisis respite as a service definition, safety net support, and one contracted provider, not a clearly identified county-wide IDD crisis respite facility with public bed capacity. HHSC's FY 2025 in FY 2025 stated that 19 counties accounted for 49 court-ordered forensic admissions. 4 counties made up 57% of that total. Bear with 10, Harris with 7, Tarrant with 7, and Dallas with 4. Tarrant County is tied for the second highest number in the state. So to me, the message is simple. Jail is not respite. Jail is not stabilization. And a distant forensic placement is not a substitute for a local crisis system. If we wait until an IDD crisis becomes a booking, a competency issue, or a court order, then we have already failed that person and that family. What is still missing is dependable local IDD crisis respite capacity. My ask is concrete. I want a joint plan from the state of Texas, Tarrant County, MHMR, our county hospital, and HHSC, and our advocacy partners that maps actual IDD crisis respite capacity, creates or contracts dedicated out-of-home IDD crisis respite beds with 24/7 behavioral and medical support, and establishes a no wrong door referral pathway from EMS, ERs, law enforcement, and the jail, and reports monthly on jail diversions, ER boarding, and SSLC forensic referrals. There is a complete lack of crisis respite options for people with IDD here in my own county, and it is so unacceptable. And I am grateful that the families of Sean Ferracio and Kyrie Campbell reached out to my office and has essentially educated me during my time in this seat. And if Tarrant County can be tied for second in court-ordered forensic SSLC admissions, then Tarrant County can lead the state in building the local alternative with your assistance. Thank you.
Thank you, Commissioner. Appreciate your comments today. The next person I have on the list signed up to testify is Catherine Godby. Catherine, are you on or in the room?
I am.
Great.
Can you hear me?
Yes, ma'am, we can.
Okay. I am Catherine Godby. I'm a retired Christian pastor and co-founder of the Justice Network of Tarrant County. We've been advocating on Tarrant County jail issues for about 3 years now. And in the course of our advocacy, we've seen several people with IDD end up in our jail with terrible outcomes. We know that people with IDD can be characterized as the least among us. They're frequently, they're people that navigate a world just not designed for them. And when they enter the carceral system, as you know, the challenges they face and the risks to their safety multiply greatly. Sean Ferraccio, Kyrie Campbell, Gabriel Pignon from Tarrant County, they could not, they do not, and they will never understand what's happening to them inside a jail. Would you allow your 6-year-old child or your grandchild to spend even one night in jail? Of course you would not. You would never do that. And yet we see our MHMR being very comfortable allowing people with IDD to languish in jail for months on end. So what does it say about us? I'll tell you one thing it says. We are utterly failing the most fundamental test of justice, and it points to a moral bankruptcy. Besides Sean, 5 other people with IDD are currently waiting in our jail for civil commitment transfer to an SSLC. And from what we heard in this committee last year, we know that the largest number of transfers to SSLCs is happening from jails and then from group homes. The latest forensic report shows a clear trend of rising forensic commitments of people with IDD. MHMR is putting people in inappropriate care settings where they're criminalized for their disability, criminalized for having a disability. People with IDD are entitled to placement in an SSLC. So why is that not the first thing that's offered to them? Why are IDD families never informed about this option? Instead, their loved ones are rotated through group homes after group home after group home, where they're at tremendous risk of being arrested. We know that. And once in jail, everybody washes their hands and blames the state for not having enough beds. But how would the state and our lawmakers know to create more beds if MHMR is not recommending that? I know that in your heart, you cannot be comfortable with institutionalizing people with IDD in our jails. So I'm urging you to do the right thing. Recommend expanding SSLCs. Let's transform them into centers of excellence. Plus, we need more crisis respite and crisis stabilization units so that no one with IDD ever ends up in jail. No human being is disposable. Thank you.
Thank you for your testimony. Next on, I have Krish Gandu. I don't have anybody else's name, but if you're here and you're online and you'd like to provide public testimony, can you raise your hand, please? I'm sorry, I can't see your name from where I'm sitting. I need glasses or binoculars.
My name's Christy Bridgman.
Okay, Ms. Bridgman, go ahead, please.
All right. Good morning, guys. My name's Christy Bridgman. My 26-year-old son, Sean, has been in the Tarrant County Jail since December of 2024. Sean's autistic and has a diagnosis of IDD. He also has cerebral palsy and seizures. His communication skills are extremely limited. He has 2 word phrases, that's it. Sean has been receiving services from North Texas MHMR since he was 8 years old, and he has been in and out of group homes since then. I had to pull him out of the last group home a couple of years ago when I found him in a state of neglect during one of my visits. In 2024, I had to call MCOT for crisis intervention, but they called the cops and let Sean get arrested. This happened twice in the course of a week. Sean has been in Tarrant County Jail for over 15 months now with charges of assault, even though I filed an affidavit of non-prosecution. I do not understand why the people who are supposed to help me care for Sean pushed him so quickly into a cage and then did nothing for the first 10 months of his incarceration. So in May of 2025, The court ordered him to civil commitment pending criminal charges. Meanwhile, he has lost half of his weight in jail. He went in at 244 and he's now weighing 148. He bangs his head on the wall and on the window. And here recently he has a wound that the news media went in to see, and his head was covered. So they frequently use handcuffs and restraints on him, and they let him walk around barefooted with no socks, no shoes. He has deteriorated a lot, and all of this is documented in his jail records. Still, no one advocated for him with any urgency until I spoke up in Commissioner's Court last month, and there was public outcry. I had been told that he needs to wait until next year for a bed in SSLC, but within weeks of media reporting on Sean's condition, I was given a transfer date of April the 14th. My question for this committee is, why is there no crisis respite or crisis stabilization for people like my son? Why is MCOT so quick to push their patients into cages? Sean is not a criminal. He did not need to go to jail. Why don't we have more SSLC beds? Given Sean's acuity and behaviors, he should have been placed on the inpatient care waitlist years ago. I do not understand why MHMR did not put him on the inpatient care waitlist for SSLC prior to his arrest, when it was always an entitlement for him and they were aware of his acute behavior. I feel like they are waiting for a crime and a victim before letting someone with IDD into an SSLC. Sean should have been sent there years ago when I first asked for guardianship in 2017. After 10 months in jail, the court finally ordered a civil commitment with pending charges. Despite my pleas, no one advocated for a less restrictive setting for him either. Before or after. In 2017, I asked our MHMR to help me get guardianship for Sean. They said they would, but nothing happened. Last year, I asked the probate court, but I was told that he doesn't need guardianship because he is in jail. That is exactly why I needed guardianship, so I could engage meaningfully in his care while he is in jail. This whole experience for the past 15 months has been deeply, deeply traumatizing. My son is not the only one in that jail. There are 5 others like him waiting for SSLC beds. I am asking this committee to make the strongest possible recommendation in the legislature to increase funding for SSLC beds, expand crisis respite and crisis stabilization in the community, and do everything possible to prevent the incarceration of people like my son. I'm so afraid that my Sean will die in this jail like many others. He does not have the ability to care for himself. He has lost a tremendous amount of weight, and he keeps hitting his head against the wall. He needs to be transferred immediately. Please don't let my son die in jail. He needs care, not a cage. Thank you for listening.
Thank you for your testimony.
Thank you.
The next person I have online is Nan Terry.
Thank you. Good morning. Sabrina Harris spoke to this committee in 24, and unfortunately she's recuperating from surgery and is unable to speak. But she gave me permission to update you with her story, her daughter's story. Her daughter Ashley was diagnosed as IDD with the Crowley ISD. After Ashley was found not to be competent in Tarrant County Jail after 11 months, Ms. Harris called and requested a spot in the San Angelo SSLC. Her daughter needs a structured, consistent routine, which the San Angelo State Supported Living Center provides. Ashley has done more in San Angelo than she ever did in any of the numerous group homes where she stayed in Arlington, McKinney, Fort Worth, Dallas, and Farmersville. She has a job. She is involved in singing programs. She was recently in a fashion show. She attends church, and she understands her routine. She never knew why she was in jail in Tarrant County. When Ashley turned 18, her mother became her guardian. I think she's in her mid-30s now. Despite her being her guardian, Ms. Harris was not notified by the sheriff's office when her daughter was in ICU at JPS. Ms. Harris found out by reading her file. Ms. Harris has had the guardianship transferred to Tom Green County, where Ashley currently resides. Several of the individuals classified as IDD that have ended up in Tarrant County Jail appear to languish until the press reports about the situation and a public outcry ensues. These individuals that have made the press have all been charged with an assault, which precludes them from entering the Tarrant Canyon Jail Diversion Center. Neither Sean, Kyrie, or Ashley were found not to be competent or to be competent. Why wasn't the SLC offered before the situation resulted in criminal charges? On MHMR's webpage, it states, if you or a loved one is experiencing mental health crisis, call our eye care center 24 hours a day. In the case of Sean, which you just heard, his mother called, the police arrived and took him to jail. The webpage says eye care services offered, but it doesn't list any emergency respite facility. Some have suggested about MHMR's Pine Street locations, but when I've asked, I was told that's where patients from the state hospital go after being released to transition back into the community. MHMR had nowhere for Sean to go. Is there any data transparency between HSSC and county commissioners regarding detaining individuals with IDD in county facilities? Do we have any means to encourage the emergency respite or emergency crisis center for these individuals? Thank you very much.
Thank you for your testimony. Krish? Krish, I think the microphone may not be on. If you just click that button. Is it?
Is it better now?
Perfect.
Yeah.
There you go. Thank you.
Good morning, Krish Kundo, co-founder and director of Texas Jail Project. Just want to repeat what I've said in the last, I think, 6 meetings. We are halfway through the year. The report is supposed to be out from this committee end of the year, and I'm hoping this is going to be a report that actually has some data that we have not seen in the last 2 reports. We still don't know how many people with IDD are in our jails. We've been doing data requests, and it's been challenging to find that number. And I think that's the sort of baseline for legislators next session to understand what to build out for this community. So I'm hoping for data transparency. And the second point that I've made over and over again is all these public comments of impacted families. And today we have a county commissioner who's deeply worried about this issue. I have never seen in your reports any qualitative data. We have brought dozens of testimonies over the last 2 years, and I've never seen any qualitative data in your reports. So I'm really imploring this committee to ensure that there is some inclusion of all these lived experiences, these stories, and of course, the data that you all are collecting. So I'm really hoping to see a report that has some sense of urgency for this population, because I just cannot understand how we are okay with the narrative that the jails are the largest places for transfers to SSLCs for people with IDD. It's just unacceptable. And thank you so much for this committee. Thank you for listening.
Thank you for your testimony, Krish. Okay, is there, I'll just say it going once, going twice. Is there anyone else online who wants to testify and has not yet done so? And I don't see any more hands. Okay, thanks to everyone who provided public comment today. Let's move on to old business. And the first up is guardianship.
So we'll just give an update on the guardianship. We were not able to get it on the commission meeting at the last meeting we had. The timing just didn't fall right for our agenda and getting it processed and everything, but it is on the agenda for this May meeting. So those rules that we worked on and presented to the board should go to vote to go on public comment for the next meeting. So that's the update for the guardianship.
Okay, thank you for that, Rick. Appreciate it. All right, let's move on to subcommittee updates. I know a lot of our subcommittee chairs are here. So I'll just offer an opportunity. If you're a subcommittee chair, feel free to step in and give us an update.
If anyone was,
Thanks, Sonia.
I have to say my name,
So
just.
Just hit the button. As long as it's green, we can hear you.
Am I sharing this? Okay, well, anyway, Sonia Burns, and I'm chairing the data subcommittee. I asked to be on all the subcommittees, and if anybody else met, I did not get an invitation. Did anybody else meet? And no, okay, so then I'd also asked that this could be more of a work session because I feel like we don't get enough done. So I will present what we discussed, who was in our meeting. But I echo all the sentiments that we heard from public comment, that if nothing else, this report needs to have substantive data, questions on how to get more data, and real recommendations. I think that what we are really hearing, and I had sent out, I don't know if everybody, so are we using this as a time to discuss mine then?
this is for your subcommittee update.
Okay.
Yeah, subcommittee update.
Okay, so I had sent out an email and I know, I don't know what your last name is all of a sudden in my brain and I was gonna call you Rick.
That's fine.
Direction officer. Sorry. And Sheriff, you all were included. So I had everybody that had asked to be on it. So it was Ann, Emily, who else was Liz? Liz couldn't make it, Dr. Pignon. And then I had asked for Krish Gandu, Melissa Shearer, who's the head of the Mental Health Public Defender's Office in Travis County. Ann McGonigal invited Jerron McGlory. And then we also had Elise Ferguson and Johnny Jaquist. So Elise Ferguson is a criminal defense attorney, was from Collin County, and Johnny Jaquist, former Jail Administrators Association, jail administrator in Collin County, retired. So we had a discussion and yes, and I have questions. So in my presenting of our data, I do have to ask some questions. We want to identify a number of persons with IDD in the jails. We want the positive CCQ matches and persons with IDD. So to that, I have a question. I've not seen that. I run a CCQ. How is it showing me that someone has IDD? Can someone tell me that? Like if you're running that through the TLS, what's the flag that lets me know? Or is there?
Well, Richard's doing a CCQ study right now, so he'd be the one to answer that.
What was the question? I'm sorry.
So we, as part of the report, we want to see the positive CCQ for, well, we want CCQ matches, but then breakdown of those with IDD. But I don't know what that looks like. So if I'm someone who wants to pull data from CCQ matches, what is the flag that shows me that this is a person with IDD?
So the way that I get the data is already separated by exact, probable, and no match.
Right.
And it's already separated to IDD. So I don't know what you mean by flag. Like I don't have to drill down anything. I just get it spelled out.
Okay, I guess, yeah, but so do you know what that process is of separating out? Because we have people served under the LMHAs. How does that IDD get pulled out from that?
I
We don't
assume
know.
it's
A
done.
connection to service, I believe. So
Connection,
if you
okay.
have had a state service, and you could speak to this because you guys are directly.
Our subject matter expert in how the actual system works, but what it does is it looks for people who have had involvement with, for the IDD side, the local IDD authority, and for the mental health side, the local mental health authority. So adding the IDD was a relatively recent addition to that system where it pulls So it's looking for match criteria, like somebody's first and last name, their date of birth, their social security number, Medicaid number. I don't know everything that it looks at, but it's kind of trying to find matches. And then look at people who have received service encounters from the local IDD authority. And then when it finds one, like data that matches, yes, they both were served by the LIDA within some time period. I think for children, there is no, it looks for any time. Then it sends the LIDA a notification. Or there's a system they check regularly, or they receive a notification that says, you've got a match, you've got an exact match, or you've got a probable match. Then they kind of do some legwork to figure out, is that somebody, in fact, is it correct data? Did we in fact serve that person? And then they do outreach to the jail.
I'm sorry, could you use a microphone with the unit running? We can't hear you well over here.
Oh, okay. I'll just move it a little closer. I'm Ann McGonigal. I work at the Health and Human Services Commission. And I was explaining that the TLETS notification, the way it works is it looks for information that the jail has about the person's name and date of birth, and then information that our systems have about people that have received services from a local IDD authority. And when it finds a match, it creates a notification for the LIDA to then do some follow-up work with the jail.
So that's where the drill down actually happens. It's in the TLETS.
Yes, and it's not looking at, it doesn't necessarily have people's diagnoses. It just knows whether they had an encounter. So in some cases, I believe, and Brian, you can let me know if this is right or not. I think some cases there has been an encounter, but it was determined that the person was not in the LIDA population because they did not have an intellectual or developmental disability.
And how does that, so are we accounting for that? Because I have a flip side question on that, but are we accounting for those that somehow showed up, but then we determined they weren't?
I think they continue to show up in the match report. Is that right? Do you know, Brian?
I would think they do.
Well, I was gonna say, Duran can speak to this. I know he's here to talk on a different topic. He was an invited guest, so I don't know if he can respond to this, but he knows more than I.
He has his hand raised.
Yeah,
Yeah, I'm just looking at you, Lee, whether. it's
yeah.
allowed.
Go ahead, Ron.
Good afternoon. Well, good morning. We're not there yet. So yes, it does trigger a match if they've had an encounter. For adults, it's within 3 years, and for children, there is no time frame. However, as Ann mentioned, anyone can have an encounter with a LIDA within those 3 years time frame, but there is the piece that's not captured is, are they eligible or not? And so we do run the LIDAs do have to report back on exact matches quarterly. And what we have just started doing recently is pulling out or flagging those individuals who were already determined ineligible and try to prevent those from being resent out, re-notified for readmissions. And also we're talking with IT right now to kind of drill down some of those service codes that are triggering the matches to be the ones that are actually like the front door entrances. So currently, if a CIS or someone goes into or MCOT and that service is entered as an IDD crisis response, but is later determined ineligible, they're going to continue to flag on that system. So we are working on trying to drill down some of those encounter codes to pull back those numbers that are for people that are not eligible. I'm not sure if I answered the question. And so back to the previous question of how that happens, I believe there's 3 or 4 specific services that were intended to be the kind of, these are the ones you need to pull from the report to then send over to the LIDA for them to respond to. That's what we're working on, cleaning up that miscommunication.
Okay, so then on the flip side, I get a lot of cases where someone's been basically required to choose between an LMHA or a LIDA, but they do have an IDD, but they're being served under the LMHA. So how many people are we doing the same sort of drilling down? Because otherwise I think we're gonna miss a lot of people with IDD who did either get a contracted beds or had some kind of services through the LMHA, but they would qualify under the LIDA, but because we're not so good at talking to each other, outside of, I think, the OBI pilot, right? Or whatever we call it, program. I'm just wondering, I just think we're missing a lot of people. And how will we rectify that?
So you're saying if, for example, someone's arrested and the LMHA receives a notification because they haven't been served on the LIDA side, is that kind of the example you're given, but they do have IDD?
Right.
Okay, okay.
And I have a lot of cases like that where, and I know that you've seen it, like, we have them on the LMHA side, but if we're really trying, I mean, so I'm just gonna be transparent here.
So we have the same issue with the LMHA side of it as well. If they're served by a private insurance, they're not in that database.
Right.
So we are missing data there. So that's is an issue with the IDD and LMHA.
Right. Right. So, I mean, like, we can say, we want to know how many people with IDD are in our jails. That will be a different number than a positive CCQ match.
Right. Yes.
And that's where I'm trying to go with this, because in full transparency, and I understand what the charge of this committee is to address the detention of persons with IDD. But I think that this is the committee to highlight for our legislators at every level that we do not have a system in place to serve persons with IDD. We just don't. And especially in crisis, just, you know, and you and I have had this conversation. We, you know, every session we give money to HHSC to pass around to the LMHAs, to contract with private psychiatric hospitals. And nobody's even said how many of these have exclusionary criteria for IDD, autism, and or nonverbal. The majority do.
That's correct.
And so where is a person going in crisis? And then we don't have, I mean, you know, so I did a list of data. I'll read some of them, but, you know, we also see a pattern of charges for a lot of the people we see, and it falls under a felony assault and it's under domestic violence. And so once you get that charge and you're dealing with the DA, that's not one that they like to let go of. So now we have someone in our jail system longer. So to the extent that we can, I think we need to create a body of work that shows, you know, here's a pattern of charges. We need to show how many people are under the age of 18. That says something. How many are under the age of 22? That says something, because we also know that in Texas, we have been called out for not providing our transitional services in our education system that we are federally required to provide. And then mapping out. And so, like, where are the buckets of data? So, okay, starting with number of persons with IDD in our jails, positive CCQ matches. How many people are on a forensic wait list? Are they waiting for an SSLC? Are they waiting for a state hospital? Are they going for competency? Is this a civil pending charges? Is this a dismiss and transfer? My understanding is that right now the jails could submit, right? I mean, well, okay, I guess back up. CCQ matches, where do they go? Who knows that? Is there, like, what is the reporting? I mean, we're running it. Then what?
So as I understand it, from what we've just talked about, what John described and what Ann described, Sonia, is the CCQ match is intended to find people who have received at some point any state-funded service, right? Acknowledging the fact that there are people who, if they got services somewhere else, they're not going to show up in that, right? TLETS is an interface that the jail has access to. So the jail staff do that. And then when there is Richard, you mentioned all the criteria, no match, probable match, or exact match, right? I think those are the three. Then there's a report that's generated that goes to either the local mental health authority, if it's a mental health service, or a local IDD authority, if it's the IDD service, right? And then the local authorities are required to report that data around exact matches on a quarterly basis, is what Jerron just said. So that's where that data goes. The number of people on a forensic wait list, I would think that would come from some other place. I don't, to my knowledge, I don't think that's captured at the local level by the local mental health authority or the local IDD authority. I could be wrong. I'm not an expert on that. But I would think that there's a process that happens between the court and the state hospital system or the state supported living center system. And sometimes I don't think we have a window into how that works. That would be the state agency, and probably not even an ANSHOP. That would be a different part of the state agency that would have to weigh in on that. Scott Shaplin's division, I would think, would have some perspective on how they do that.
I mean, I know here in Travis County, if I call any of my lawyer friends, they get an update from the jail every week how many people are on the list and where what number of days they've been waiting and what they're waiting for. But that's what I'm saying, like, how do we get these systems to talk to each other? Because basically the commissioners courts need to be screaming. We don't, and so that's what
There's a
I'm,
lot of need out there, for sure.
right, but I just, so with the data, I want us to like provide a report, and I'm just trying to figure out where are we gonna get this data? So what, on the jail side, because the sheriff should be motivated to get the people out of their jails and not have them come in. So on the jail side, they have the data of the positive CCQ matches, correct? So could they be submitting that?
Now, the CCQ was designed to notify the courts and the attorneys that they have somebody in jail that's gonna need competency or possibly need competency. And then it goes to the JP, right? And the JP has orders a examination to be conducted on that person. And that examination, the JP makes a determination whether or not they need to go forward with possible competency or not. So that's what that CCQ data was designed for the jails. They don't track it. They don't do anything else with it. They notify the justice. That's, and then they're out of that. They're done with that. It also notifies the LMHA, like we said, or the LIDDA, and then they, are supposed to come out and see them and start that process of trying to get them out of jail. That's what it's designed for. So they don't track any of that data that I'm aware of. Now, individual jails at some point might somewhere, but I'm not aware of anybody that tracks data in the jails.
So then if we're saying we want a monthly snapshot of every jail and their CCQ matches, how would we do that?
I think we have that, don't we, Richard? Yeah, we get a report on that. That's one of the study. He's working on a study right now for CCQ.
Okay. All right, so we'll do
And
that.
that gives you exact and probable and all that stuff. They do that on an annual basis. So you can see across all the jails that do this, like what those numbers look like.
He posted a report that we get.
That's what it looks like.
Oh, excellent. Thank you, Richard. Yeah.
Okay, and then if we're trying to capture a total number of IDD, are we gonna then go back to 1622? What,
That's all the data we have at this point that we're aware of is the CCQ data. We don't have any, because jails, like I said, jails don't track and report to anybody of how many.
Judge?
yes,
It's not necessarily that the CCQ is being run in the jail. It's who are they giving that information to? I was a prosecutor for 8 years. I've been a judge for 15 years, and I don't know a single judge in my county or surrounding counties that's ever been notified of a CCQ hit from the jail. Because they take that information, they throw it in the medical records, they call it HIPAA, they don't send it to the defense attorneys, they don't send it to the district attorneys, and they don't send it to the judges.
So
So it's effectively useless unless we're getting a report of whoever the CCQ runner is. The report needs to say, who did you give the information to?
So we check that.
It's not making it upstream.
So we check that whenever we do jail inspections to make sure that the justice of the peace that arraigned that inmate was notified. It's the responsibility of that justice of the peace that did the arraignment to notify the people you just said, the DA's office, the attorneys and so forth. We don't have purview over justice of the peace. We have purview over the jail. We make sure the jail is sending that information to that justice of the peace. If it stops there,
I don't think it's making it that far in a lot of counties.
it is, because we check that on inspections.
Good point.
Yeah.
Bring it up after it gets the jail, gets it, what's the next kind of command up? Some that is addressed, that they need to be sharing that.
Over the justice of the peace,
Yeah.
OCA, I assume. I don't know what that structure looks like. Go ahead.
I know that answer as far as, so in the jails under the Code of Criminal Procedure 1622, the jails notify the magistrate in the jail. And then the magistrate needs to make a determination.
Mhm.
And then determine whether or not they want to get that interview and report done. And the data at the end of this would be any reports back from the person who did that, so the LMHA typically. Any reports back go to the clerk and the clerk notifies OCA. but most counties are not collecting that data. And so if you run an OCA report on 1622, you're going to get mostly zeros.
Yeah, this is gonna-
1622 is different than I'm Judge Jan for Denton County Probate Court. And the 1622 reports and evaluations are different from the CCQ query.
Correct.
And the CCQ query is, I'm gonna get the statute wrong, but it's under what, 614 of the Health and Safety Code, I believe, provides a list of who's supposed to get that information. And it doesn't say goes from the jail to the first magistrate, and the magistrate dispenses it. It says these people are supposed to receive it. And in our county, JPs don't arraign anything. I'm the 7th largest county in the state. We've got county magistrates and city magistrates that do that initial arraignment, and all of that. And Colette is my attorney administrator. I brought her down here today because she's also a guardianship expert, has been a magistrate in many of the local cities in Denton County and has never seen the report you're talking about. So, and I mean, I've got a pretty big network in the state as well. And at the prosecutor level and the criminal court judge level, they're not getting that information. And the defense bar is completely unaware that they're supposed to receive that report as well. So if it's going to the JPs, there's a fundamental breakdown in the dissemination of that information at the levels that can make a difference to get people's cases moving through the jail.
I don't disagree.
And it's so.
Yeah, I mean, I think this is why the Judicial Commission's been working on this a lot. I know, Judge, you're a part of those conversations. I've been a part of those as a representative of the LMHA, local IDD authority system, and others on our team have been. Yes, I mean, I think there are definitely some things that could be explored around what the process should be and what the process actually is. So appreciate you stepping into the conversation. Thank you.
Then I think for this committee, then we should be making a strong recommendation. So now what could be a resolution there? If we're talking
Yes.
about the CCQ, that means they've touched the public health system. So then, like we did where we funded state hospital transition specialists at every state hospital, would we then have a dedicated staff at every LIDA, LMHA that is responsible for looking at CCQ matches and making sure that information gets to all of these people that it's supposed to get to? That seems like a reasonable recommendation to.
I mean, perhaps as I think about that, but I mean, you know, you've got a dynamic here, and this is part of the complexity, I think, of the conversation. You've got the jail, right? Which is an entity involved in this process. You've got information that's shared between the jail and the local IDD authority or local mental health authority for a part of the process. And then you have expectations around information that's shared from the jail to the court so that a criminal offense potentially can be adjudicated, right? And so you've got like the three entities. Now, I love the idea of having additional capacity in the local mental health and IDD authority. Sonia, you and I have talked about this a lot. The last legislative session, the state hospital system received additional resources to be able to bring people dedicated to help folks transition out. The local authorities did not receive the same level of investment for that. So I think a lot could be done in that space. But I think that's just a part of the discussion. I think the bigger, broader part of the discussion is how do those entities at the local level interact with each other? And then also acknowledging the fact that we have 254 counties in this state. And there is a lot of variation because there is a lot of, I mean, like our local authorities can't tell the courts what to do.
Right,
We
and this
can't
isn't
tell the
telling you
jails
what to do. This is
You know, I'm making that point to just say that,
Right.
you know, there has to be a certain level of collaboration at the local level. So I love that idea for recommendation. And I think, you know, if the subcommittee wants to put something together to lay out some recommendations, like in writing that we can look at ahead of time and give some thought to, then I think this is a group where we could all sit down and kind of look at those ideas and think about them more specifically. So I also want to be mindful of the fact that we do have other reports that need to happen, and then we've got guests here to present.
Right,
So
I'm almost done. It's just that nobody's met, and like, here we are, so thank you. On who can provide what data, so then HHSC, I'm assuming can, like, so now we know what we can do with the CCQ. Richard, on the thing that you posted, was that all IDD? Or was that the full?
That's what was mental.
Okay, but there, you have a pullout with just the IDD. Okay, with all the same things. Okay. And then HHSC can give us the monthly, who's on the wait list and what they're waiting for and what it is, right? Dismiss and transfer, criminal, municipal pending charges, or competency.
I mean, I don't know that for sure. I'm not
I mean,
an
somebody
expert,
knows it.
but I would think that based on the conversations I've heard, that there are interactions between courts and jails and the state hospital, especially when somebody's on that list. We don't manage that forensic list that the state hospital system manages, but I mean, I'm just speculating. I think that would be a question
Well,
better
I'm
placed to
just saying,
Scott.
as a committee, I think
Yeah.
like, I mean, I can do open records requests myself, but I think as a committee, we can also make an agreement that we should be collecting certain data, and I think the state should be working with us on it so that we
For
can
sure.
solve this issue. And then since Kima is in the room, I will take advantage of you. We were also saying that we would like to look at the pattern of charges and places of arrest. Is that OCA data? Is that something that we can connect to effectively, or is that just a recommendation? I don't know what to do. Because we could recommend a report, like a drill down, like we did of, the state auditor's report that left out IDD, and make a recommendation for a report on how to drill down on IDD. So you think that that's not just easy data to pull, but
You're wanting to pull
place of arrest and
type of
charge
for, just for people with
of the-
IDD.
yeah, in the jails.
I think I don't think we have that capability at the moment. I know that OCA is doing, I mean, you could do it generally, but I don't think you could drill down for a specific group of
Population.
individuals at this time. Although they're within the next 5 years trying to go to a, what's it called, with 5-person, as opposed to aggregate data. But I don't think it's still even in the creation phase, there's not even an example.
So maybe that's also like a recommendation, because I just think if I'm somebody, if I were the governor, and then if I'm like a county judge, I'd want to be able to pull that pretty quickly and say, wow, we've got all these people and this is what's happening. And then with the LMHAs, the other thing we just looked at, like the asset map. So would it be the LIDAs that would provide for this report in their regions, crisis services, the availability of OBI? I think we're having that conversation today. I was saying transition services in the schools. I don't know how deep we want to go, but is that something I can get from all the LIDAs? Where's that?
I mean, I think we're going to hear later today in the presentation to get a better sense of the statewide picture on OBI. It's only available in a handful of communities, as we've talked about. So yeah, I mean, that's a clear place. And then I think there's been a lot of conversation about, exclusionary criteria that happens in private psychiatric hospitals. There's a lot of conversations about those issues.
But could
yeah,
LIDA do a breakdown of their counties that they're over and say, this is what we have availability, this is the capacity to serve?
I don't know. Do you want to
Okay.
talk about that, Erin?
Yeah, I can weigh in, and Anne might want to as well. The local IDD authorities could tell you, or HHSC or Texas Council could give you a breakdown of the crisis respite funds that are allocated to each LIDA, which are very limited. So they could tell you, this is how many clients we're able to serve in a year with this amount of funding. And this is how we do it, out of home respite, or excuse me, in-home respite is the most common because it's the easiest to deliver. But if you're thinking like, they'll know what else is in the community that might be operated by someone other than themselves, I think that's gonna be like so limited. I can't even think of a private provider that just does IDD crisis respite.
Right. Okay. And then just last thing, not really, but I know we've had this conversation, the JCMH, we don't have school records. So someone shows up in the system, the records, I think we narrowed it now. It went from 7 years to 5 in the school system. So now I'm an adult. Somebody wants to help me. We have no records. I think there needs to be a strong recommendation from this entity that we have a repository of those records. It should be built on HB 1188, which was Rep. Manuel, Senator Zapparini. which is that connection. Once you're identified, the school is responsible for connecting you or offering the connection to the LIDDA. So let's build off of that and do something, because it's just, I don't know any attorney who's not dealing with this almost on a weekly basis, probably, where it's very clear somebody is living with IDD and they can't access anything because I don't have the paperwork to show they had something by 18 or by 22. And I think that having the jail commission say this is a problem we're facing would support all stakeholders. But what I wanted to say earlier is that I just don't want people to end up in jail, and I want to get them out of jail. And I think this is the body to show it, because the legislators, and also, as I've said in the JCMH meetings, I think it's really important to put a glossary and say what words we used to use with IDD. Even in a conversation yesterday with a legislative office, someone, after I'd used it about 10 times, said, I'm sorry, could I just stop you and ask, what is IDD? And then they suddenly cared a lot more about what I was talking about.
So glad you got that question. Because a lot of times you don't.
Right, but I think we need to.
Yeah.
We did, that's why we
Oh, yeah.
need to, as we bring up.
100%.
We need to just identify them, because we don't know who's in the room that doesn't know what that means, whether it's.
And I think the other, if there's a need for a glossary with formerly, I think you could still say it and it still won't mean the same thing as what.
Clearly.
Sorry. Okay, I'll stop now. I'm excited to hear.
Thank you, Sonia. So the next subcommittee chair is Dr. Pignon on the report writing committee. Do you have an update for us?
Yes, and we weren't able to get together during this quarter. We had a couple meetings, and the last one I had an emergency. So we're trying to get everyone together, hopefully in May, and get started on that. So we'll hopefully be able to start gathering all this information for our next meeting.
Great. Thank you very much. And then if my notes are correct, we combined the intake screening and community services subcommittee. And I think I identify myself as the chair. We have not had a chance to meet, but we're going to work on that, likely on a similar time frame to Dr. Pignon. So, and Sonia, I think the points that you raised, I think would be helpful to that as well. And I think it'll be useful to pull some of that conversation about capacity and what's available into that. I've always thought of that community services kind of piece that used to be a subcommittee on its own as like how do you identify what's available and what's not available? And you know, again, it's more complicated because it's not just the local authority view, right? There's a broader ecosystem out there. And so we have to be mindful of that. But I think from a local authority perspective, we can certainly bring some information to that work and then rely on others here today to help inform that too. So more to come on that front.
And really quickly on that, I meant to say that I think, and I did reach out to Steve Wallab yesterday from the Texas Hospital Association 2 days ago. I can't remember. Anyway, I get calls often from people who are going to violate all things HIPAA, and they have someone with IDD in their ER and they have no place to send them. I don't know how they find my name and number. And then they call me and ask, where is this person supposed to go? So I wonder if the hospitals would be willing, because they're certainly seeing these individuals. There's no other place to go usually, right? So could we see what kind of data they'd be willing to collect? I mean,
So
and I know.
that's right. Sorry to interject. I was actually for the Sunset Commission, us as Integral Care, Brian Campbell, representative of Austin Travis County local IDD authority. We're actually trying to make that very recommendation. So we have like a memorandum of understanding where we can share continuity of care information with jails. And it would be so helpful if we had that with hospitals for the purposes that you're talking about. So I would love to see that included in our list of recommendations as well.
All right. Any other updates on subcommittees before we move on? Again, I want to be.
I think, Brian, don't you have a subcommittee? training and something or?
No, that was folded into
Okay.
the other ones.
Yeah, that was, if my notes are correct, which they may be, data and training were folded into the same one. And intake and community services, and then we have the standalone report subcommittee. I'm glad I have my notes. Okay, so let's move on. The next item on the agenda is the OBI program presentation, and we have some guests here today. And so Jamie and Aaron, I want to turn it over to you guys to kick things off.
And Aaron, before y'all get too far, Jerron was invited also to speak to this. I don't know if that made y'all's radar. Okay.
Great.
That's great. He's got a presentation.
Okay, so the presentation that you guys will see today is actually a combined effort for from Integral Care and then Bluebonnet Trails. And unfortunately, the presenter from Bluebonnet is not able to be here today. So Brian and Tanisha are going to split the presentation, but I'm going to try to share my screen and see how this goes.
And Mr. Johnson, would you like us to like kind of get up to the front to present?
That would be great.
Okay.
If you'd like to do that, if it's easier, go for it. Yeah.
Okay.
And know that if you're a member, you want to sit at the table, you can do that too. So either way, whatever is easiest for you guys.
Three, okay. Sorry, 1 second. Huh.
Y'all are both visible.
Okay. Great. If you look back here, Brian, you can see the box.
Yeah.
Yeah.
It's not showing up there, huh?
No. So where did we go?
Let me share it. We could get it sent out to everyone, and then if you guys just want to talk through the screens.
I'd like to be able to do it.
So would you be able to post it in the chat for us?
Yes. Maybe that's you now. There we go.
I see it now.
Okay. My name is Brian Campfire, and I am a representative of Austin Travis County Integral Care. We're the local IDD authority and the local mental health authority in Travis County, and I am here co-presenting with my colleague.
Hello, I'm Tanisha Smith. I also work with Integral Care. I am the supervisor for the OBI program.
Okay, so today we are going to be presenting on outpatient biopsychosocial services for people with intellectual and developmental disabilities, supporting individuals with dual diagnosis of IDD and mental health and/or substance use disorders. So what is OBI? The OBI program is a collaborative care initiative which provides holistic support to children and adults with dual diagnosis of an intellectual disability or a developmental disability and a co-occurring mental health or substance use condition or behavioral challenges. The program brings together multidisciplinary teams of professionals who work together to provide coordinated, person-centered care that addresses the individual's medical, behavioral, cultural, and social needs. So the initiative was created to try to establish best practices for the delivery of mental health services to the IDD population where there weren't any. Some goals of the OBI program are to improve emotional and behavioral functioning, provide skills training and development, reduce psychiatric hospitalization and incarcerations, prevent placement disruption, support independence, strengthen caregiver capacity to keep individuals in their current living environment. So to kind of prevent for what we call unplanned care transitions, which are, kind of, so not having to wait, until a person goes into crisis. So at Integral Care, we house the OBI program within our IDD crisis teams. So it's like both helping with the delivery of mental health services and crisis prevention. So a bit about biopsychosocial assessments. The biopsychosocial assessment collects important information about an individual's biological, psychological, and social factors, provides a clear understanding of the person's strengths, needs, and values, serves as the foundation for the person-centered recovery plan, which I'm going to talk about in a minute, and helps develop meaningful goals and measurable objectives that support recovery, well-being, and quality of life. We began OBI as a pilot with 5 local IDD authorities and together kind of formed as a think tank. And the biopsychosocial assessment, I think it's like 19 pages. Yeah, so they do that over the course of several interventions to really try to gather a thorough picture or snapshot of a person's life. And then after performing the biopsychosocial assessment, person-centered recovery plans are developed. And this is a self-directed plan created by the individual. It identifies the person's choices, dreams, and aspirations, provides trauma-informed treatment strategies, and acts as a roadmap to guide engagement and recovery. It encourages collaboration between the individual and their support network. So one of our kind of buzz phrases is like strengthening the supports that are already in place. And the goal is to promote meaningful progress and long-term recovery. So services provided. The OBI program offers the following services: collaborative care case management. So this is coordination with medical and behavioral health providers, school personnel, IDD service coordinators, justice staff, and many others. At Integral Care, we regularly staff cases with our chief medical officer. So looking at things like polypharmacy and diagnostic overshadowing and trying to, we get a lot of clients who might come to us with a med list that is, 13 medications long, and learning things like, a best practice might include that you are not, kind of on multiple meds of the same class, for example. And we'll see a lot of clients who might have, 4 or 5 antidepressants or 4 or 5 painkillers. And, Tunisia's team has done things like color coding, reach for the ibuprofen before you reach for the codeine or something, just to help kind of make things clearer. Skills training includes hands-on training on a large variety of skills, to include independent living skills, social skills, communication skills, desensitization training, employment preparation, and much more. Behavior supports and strategies. So teaching coping skills, really taking like a strengths-based approach, emotional regulation, anger management, harm reduction, and anxiety reduction. Family caregiver training. So caregiver support is critical for long-term success, trying to get everybody on the same page. A lot of times systems of care may have different goals than the client may have. And so trying to, kind of get everybody to be listening to the person at the center of the care. Crisis prevention strategies. So things like safety planning, risk of harm assessments, higher levels of care as needed, looking at things like their level of need, working with the service coordination team to help quantify, is this person's level of need commensurate with their actual needs, referrals to substance use rehabilitation. Also, there is a community education piece of this included in our contract, which looks just like this, where we are contracted to provide 10 trainings per calendar year to professionals to help kind of spread awareness and spread the information. And sneak preview at the end of this presentation, I'm going to have a QR code that I'm going to ask you guys with a 1-question survey. Did you learn something at the end of this presentation? And that helps us to kind of document that we're doing these trainings. The why. Why is it important to talk about services and experiences of people with IDD? IDD is more than just a diagnosis. IDD occurs during the developmental period. And so for many people, it is an integral part of their identity. As a local IDD authority, we need to ensure that we are practicing belonging and inclusivity, especially to people with historically marginalized identities. So facts about developmental disabilities. The onset occurs during the developmental phase, so by the age 22. Some examples can include autism, cerebral palsy, fetal alcohol syndrome, hearing loss, traumatic brain injury, may or may not include an intellectual disability, and things like learning disabilities and ADHD on their own are not developmental disabilities. And one thing that's really important to talk about is how developmental disabilities impact cognitive functioning, because this helps explain why people with intellectual and developmental disabilities are often overrepresented in correctional settings when compared to the general population. So one statistic I like to cite in trainings is that multiple studies have shown that people with intellectual and developmental disabilities make up like 3 to 4% of the world's population. That's based on really conservative estimates. We know that like a lot of underreporting, as we've discussed already in this meeting, happens. And also multiple studies have shown that when it comes to jails and prisons, the percentage of people with intellectual and developmental disabilities is more like 10%, 1 in 10 inmates. And so that is really, an overrepresentation. And so, yeah, bringing it back to how developmental disabilities can impact cognitive functioning, executive functioning. So the ability to kind of plan and make judgment and, stop and think before acting is impaired. Learning and memory. So things like repetition can be really essential. Things like cognitive reserve, a person's ability to kind of manage stress in real time. Language and communication, processing speed may be slower, may have reduced vocabulary, and may be hesitant to openly express or self-report symptoms that are happening. I'm going to transition to Tanisha for the rest.
Thank you, Ryan. When we talk about the different levels of IDD, we think a lot of people with IDD are usually put in a box. You know, a person has IDD, it means this. Well, really, there are different levels, and most individuals that we interact with will have a mild IDD. It's where they can read, they can write between a third and sixth grade level. So most people, when they think of IDD, they think of the profound or the severe, someone who isn't able to communicate with words, someone who isn't verbal. But in reality, we're really looking at the mild population most of the time. And so it's just a really good thing that we point out within these trainings. So again, we don't put the people in the box and we're not like, oh, a person with IDD means that it can look different for every person. IDD and mental health, we like to point out how it impacts a person. So they already have this IDD diagnosis plus these core impairments, right? The trauma for a person with IDD is higher than it is in the general population. A lot of our clients are dealing with some sort of PTSD, right? Which shows up in behavior, and it's never diagnosed as PTSD. It's just, let's give them a medication. Let's put them on a behavior support plan. Diagnostic overshadowing, as Brian said, is something that we see all of the time. Medications, instead of, if a medication isn't working, instead of tapering them off or taking that medication away, more medications are just added on top of what they're already taking because they feel that the medication isn't working. Physical health conditions is something that we always want to rule out with this population because, again, if we have someone who doesn't communicate with words, you know, if my mouth hurts and I punch a wall, I don't need a behavior support plan. I need someone to look into my mouth and see why it's hurting, right? So we always want to look at these physical health conditions before giving someone with IDD any kind of diagnosis. Again, behavior support plans, medications are the first line of treatment, right? We don't really see what the issue is. We just go straight to these interventions before anything else. Communication difference make standard assessments and treatments a challenge to access. Again, the communication is different. The way they communicate is different. What someone might be trying to relate to us may sound different than what we're used to hearing. And so during an assessment, it may be a bit trickier, right? But all they need is a little accommodation, a little listening, right? Talking with the care team. They also have a lack of availability of mental health services. I know it was mentioned earlier, psychiatric hospitals. Once you say someone has an IDD, automatically they're like, oh, we can't serve them. Well, really they want to know, can they participate in group? Can they do their ADLs on their own? You know, but IDD, it's put in this box, right? We can't serve that person. We don't know how to work with that person. What we've also seen is a service cliff for transition age youth. When they leave school, all of those services end, right? There's no more PT, there's no more OT, there's no more specialists that they were receiving at school. Everything just kind of stops. If you're not in a Medicaid waiver, if you don't have the ability to receive the services that you were getting in school, everything is kind of cut off as you go into adulthood. Common challenges that we see in OBI is the lack of specialty providers such as therapists, BCBAs. Again, I'm going to keep repeating this. We hear all the time, I don't know how to work with people with IDD, right? So they don't have as much access to therapists, as much access to these other providers. Clients are slow to make progress. OBI comes in and people are like, oh, okay, we're going to snap our fingers. OBI is here. Everything's going to be great. No, we cannot stop a crisis altogether. We will work with a person. It takes a lot of repetition. And it's good to point out that progress. We had a client that we worked with for an entire year. Mom was like, I don't see anything different. And I'm like, well, now he walks away instead of punching a wall, right? It took us a year, but we're here. You know, we have to look at those things. But again, clients are slow to make progress and people may not see it as progress if it's slower. We have a lot of language barriers and expressive communication deficits, right? That make services more challenging to receive. Also systematic barriers such as Medicaid waivers programs or lack of housing and staff. I mean, we all know how much group home workers are paid, right? It's a lot of turnover. It's a lot of things that go into the challenges. I want to touch on diagnostic overshadowing again, just because it's something that happens so much, and it refers to the tendency for healthcare providers or caregivers to attribute a person's symptoms, behaviors, or emotional distress solely to their intellectual disability, rather than recognizing the presence of a separate medical, mental health, or behavioral condition. Right, so everything that happens is because this person has an IDD. We work in a county where we're fortunate to work very closely with our LMHA. We talk all the time, and there's a lot of times where they're like, oh, it's because of the IDD, it's because of the IDD. And it's like, oh no, well, we also have to think like this person has this bipolar diagnosis, this person has this schizophrenic diagnosis. Do we ever think that these symptoms can be happening because of this? And so we really have to drill that down. And just because a person has an IDD, it doesn't mean that every single issue or challenge that they're having is due to that IDD diagnosis. Reasons why diagnosis overshadowing happens. Again, the communication barriers and limited training on working with the IDD population. A lot of therapists, doctors, everyone will tell you, they're not really, there's not a class or anything that teaches you specifically about working with individuals with IDD. It's if anything, it's mentioned very short, maybe one chapter in 10 books that you've had over your, whole education journey. So it's not something that's taught on how to work with individuals with IDD. And so a lot of people don't feel comfortable, or they don't feel like they have they don't feel like they can work with this population. Again, atypical symptom presentation. People with IDD may show illness differently. But like I said, I'm punching a wall, right? It's because I'm sick, not because I'm upset. These are some expected outcomes of OBI. We want to improve behavioral stability. We want to improve mental health services, increase the use of coping skills, reduce the need for emergency interventions, less hospitalizations and incarcerations, greater community participation, and overall improved quality of life. I'll hand it to you.
Okay. And we definitely wanted to share some success stories. And this one is from Bluebonnet Trails, also one of the original OBI sites. So in the OBI program, the Bluebonnet Trails team has been working closely with a 47-year-old man diagnosed with autism, anxiety disorder, ADHD, and bipolar disorder, who is facing 2 felony charges and 1 misdemeanor charge. Through the collaborative efforts of OBI, mental health, and jail diversion teams, they were able to effectively communicate with the court regarding his diagnosis, his upcoming surgeries that will have him bedridden for approximately 3 to 6 months, and his willingness to continue working with the Bluebonnet team as a part of his recovery process. On his scheduled court date, he arrived on time with support from the family, the OBI collaborative care case manager, and other team staff. Despite experiencing severe anxiety related to the court proceedings, he successfully utilized coping skills and support strategies to manage his symptoms and participate appropriately. Judge Stacy Matthews presided over the case and commended the BTCS team for their presence and for clearly communicating the services and supports being provided. As a result of the team's involvement and advocacy, the charges were dropped, and he was encouraged to continue working with the Bluebonnet Trails collaborative care team to support his ongoing recovery. Judge Matthews expressed strong appreciation for the OBI and the other teams, acknowledging their dedication and the critical support that they provided to individuals in need within the community. Today, he continues working with his OBI case manager on goal attainment, compliance with mental health service, and risk reduction. He works with the jail diversion team on probation compliance and on ongoing education about refraining from activities that lead to recidivism. He now lives with his family, who provide additional supports to keep him focused on a positive path, and he feels confident that his worst days are behind him. So we're talking a lot about the gaps in the system. And so this is precisely what OBI is like aiming to kind of step in to do. And now we're going to share a success story from Integral Care.
Integral Care's EMCOT team sent over a huge thank you to OBI. We had been working with a client that was 73 years old, who lives alone with a mild IDD diagnosis and major depressive disorder. They said Rachel with OBI has been wonderful to work with, and they haven't seen a decrease in EMS calls like this for the client in a really long time. EMS sent over the info regarding the 911 calls. The client called 152 times in 2004, 29 times in 2025, and 10 in 2026. And EMS even offered to express their gratitude to the OBI team in form of coffee and cheesecake. OBI was able to provide more intensive care and coordination to the client, which she stated helped her feel more cared for and supported. The client attributed OBI's weekly visits to the reason why she no longer felt the need to contact emergency services. So again, as Brian said, just providing that gap. She felt she didn't have anybody else to call. She needed something. It was immediately 911, whereas Rachel came in and she was like, how about we call a nurse? Or how about we do this instead? You know, just doing that skills training. And with some repetition, she was able to use that. She's now telling OBI, like, I don't need you guys anymore. I'm fine. And so we were just glad we were able to help her and strengthen those support systems around her. Questions?
Well, I'll just start by saying thank you guys for this presentation. I appreciate all the work that went into organizing it to be here. This was a topic of discussion that we had at our last meeting, and you know, a few of us felt like it would be important to have some more information about OBI, particularly. I'll look at this through kind of a legislative lens. You know, this was one of the bright spots in the appropriations bill last legislative session. So, you know, as our folks described, this is only available in a few communities. The legislature increased access to this program, so it's going out to a few other communities. I think, is it 7 or 8 now?
8.
8.
So it'll be 13.
Yeah, so there'll be 13 sites online. We would like to see this program operate on a statewide basis, and then it's very likely a program that could be an area where the legislature continues to invest. You know, I was always taken by the fact that, you know, the state agency, Health and Human Services Commission, started to begin to like identify data around prevalence of people with co-occurring behavioral health and IDD issues. And today, I think that's about 40%. And so, you know, a high number of people have those issues. And so the OBI program is one tool in the toolbox. And I think a really important thing for this committee to have a sense of and a deeper understanding of. So thank you guys very much for being here. And any other questions, comments?
Yes. What's the capacity?
Good question. So ostensibly 25 clients, although we kind of in practice kind of stretch that a bit to.
So per the contract with HHSC, we have to serve at least 25 clients. Yes, so it depends on the county and their ability. We have on our team, I also serve as a collaborative care case manager, so I have a caseload. We have a full-time case manager, and then we have a part-time as well. So we serve anywhere between 25 to 35 clients at a time.
And we think that's true for all the sites? It has to be a minimum of 35?
It has to be a minimum of 25 for each site.
I mean, 25, and that's
For all.
length of time. Like a contract is a year.
Juron is on its monthly, right, Juron?
What?
I think it's a monthly.
The target for 25 is a monthly target.
Okay, how long?
But not new ones, just like.
No,
Just
just a
services.
yeah.
Right, so.
25 individuals must have received an OBI service for that month.
And how long does someone typically stay on the OBI?
That varies. There's not a kind of required end date. Bluebonnet does it for a year. We do it ongoing.
And then the
I believe
cost.
the longest person I've seen based on a report I just looked at, the 2022. So I think the original intent was 9 months to 15 months, but of course the need continued to be there. So of course they've extended it to as long as the person needed the service.
And then, the cost, is it like a set rate? What is the funding?
They receive an allocation for it. And so it is a set amount per fiscal year. that they receive. Not per, no, it's not broken down per person.
Okay.
And Sonia, if you're interested, I can quickly get you, if you want to know the data on how many people were served through the OBI across the state, again, this is just with the 5 sites.
And while we're taking questions, if anybody's able to scan this QR code, that would really help us out to be able to receive credit for the training. Thank you.
And I have that number.
Yeah, John, confirm it's 228 people in fiscal year 25.
Yes.
5 sites, and we added 8, so now there are 13 sites.
So now there are 13, the additional 8 are not, and I think I might be stepping on John's toes when he provides his information, but the 8 additional sites, the expectation is that they will be actively serving people starting 9/1 of this year. So they've received their funding. They are doing a lot of, the existing sites have been providing support to them. My team has been providing a lot of support to them. So they are kind of in the hiring phase and getting up and running. So people are not receiving services from those sites yet, but they will be soon.
Okay, and I think last question, how are you finding these funds?
We get referrals from multiple different sources. Again, this may vary site to site, but at Integral Care, I'll just like a lot of times we use the kind of crisis intervention specialist program that we have as kind of like a funnel because the crisis intervention specialist program is 90 days. So if someone's needing like more intensive ongoing, I think a vast majority of our clients come from CIS. And because this is so time intensive and because engagement is a really, really crucial piece of this, like, I mean, showing up for your meetings and things like that, it's a big time commitment for the clients. And so that has helped us to kind of have successful participation and engagement and longevity. Yeah.
Is the program voluntary?
Yes.
So how many people are you finding from the jail? Because you mentioned, I mean, Wilco's person seemed to be justice. But then Integral Care.
We, again, like kind of, I think CIS is like the first line of service typically from jail. But like we are helping with clients, you know, who end up with criminal justice involvement and are doing prevention with those clients.
And Brian, you could conceivably receive a referral from the CIS based on their knowledge of somebody with criminal history or justice involvement.
Yes, and you do that all the time. Yeah. Judge.
Right?
Yeah.
Is this done primarily through the LMHA or through the LIDDA?
Through the LIDDA.
Okay. And you're a pilot program for that?
We, I guess it's no longer.
We don't call it a pilot anymore. It started as a pilot with those original 5 sites, and then the legislatures continued to fund those sites plus the additional funding. So we consider it a full-fledged program now that we continue to expand.
Which community centers have this?
I bet John has it pulled up in front of him. I don't.
I do. It might be helpful for me to go ahead and go into my presentation because I believe some of these questions that are coming up are in the presentation I have. So let me go ahead and share that real quick.
Thank you.
Can I have some questions before you go on. I'm not sure if you're gonna, but maybe they have to do with this. I wanted to know, again, this is Dr. Pignon. I wanted to know for our legislative report that we're getting together, what are the outcomes for your OBI participants? Have you had like a reduction of jail bookings or 911 calls or ER visits? Do we have some data of before and after that we can include? Where are we getting them? How are we also doing with families who don't speak English, right? How are we doing with that subpopulation?
Yes, so I can address some of that in the the supplemental.
Then
I'll call it
them
supplemental at this point.
I'll hold them until you
No
present.
problem, no problem. All right, I was gonna make sure I share it, but it's not opening up. So
I see it.
Yes, ma'am. All right. So again, originally the 86th legislator allocated $3 million to 5 sites. So that was Integral Care, MHMR Tarrant, Lakes Regional, Blue Bonnet Trails, and the Harris Center for Mental Health and IDD. And that started on 9/1. We have expanded, and I don't know why it's not. There we go. So you guys can see, and there's a map that's not showing. Give me one second. There it is. Oh, go back. And then the 89th legislature expanded to the 8 additional sites, and there will be starting services 9/1 of 2026. That'll give us a total of 13 sites. So those additional sites are Texas Panhandle Center, Central Counties. Don't know why my mouse not there. It keeps not doing it. Texas Panhandle, Central Counties, Emergence Health Network, Spindletop Center, Permia Care, New Oasis Center, Denton MHMR, and Texana. So those will be the 13 total sites. That'll be a total of 71 counties out of the 254 counties in Texas that will have an operational OBI site starting 9/1. And so, again, Brian's team went over some of the service provisions, the biopsychosocial approach, which includes that assessment, the case management piece that does a whole wraparound of the services, the education and training, which is that community outreach to professionals. We've seen law enforcement trainings. We've seen them go out to universities and do some talks and kind of get people interested in becoming, immersed in that IDD world. And then the skills training. The skills training is very unique to me because it's not focused just on ADLs. It's going to talk about teaching the population about the true day-to-day things that are going to help them be more have a more positive interaction in the community. So understanding boundaries, communication skills, establishing healthy relationships, understanding their own diagnosis and their medications, even some of the common things like learning how to drive, learning how to access bus routes, and also developing and enhancing resumes for job searches. So those are some of the things that we're seeing in the OBI program. To touch base on your question about those that need assistance that may not be of English speaking, we have seen with some of the expansion sites, we have seen positions posted for staff that are dual language and pay an additional stipend for those staff that have an additional language that they can pull in those non-English speaking or Spanish speaking populations. Another thing I wanted to point out that you asked about the stats. So since the rollout of the program, collectively, the pilot sites have served about 575 people since the inception of the program back in 2020. We've seen a decrease in hospital days or hospital stays by 52% in one fiscal year. And that's comparing data from what's reported to them before they start the OBI program. And then while they're in the program, we see those days kind of taper off. And in a similar vein, we've seen a decrease in jail stays from 82%. So someone may have had a frequent admission to a jail facility, but while they're in the program, they may not have any. So there was an 82% decrease for people that were served through the OBI program. So that's the quantitative data. Some of the qualitative data is we've heard stories about how participants in the program have were really focused and really engaged because it is very intense. I think Brian mentioned weekly visits with their team and participants that are in the program. We've also seen an increase in reports that families for the first time have actually been able to see their loved one as a person and not just a diagnosis. And also for the first time, just seeing them in a new light and being able to immerse them into different experiences. So that's some of the additional information I had for the OBI program.
Thank you so much, John. That's really great
No problem.
information.
What is the follow-up on, I don't know what to call a person, I wrote down graduates, but I mean, we're saying what's happening, reduction in this and that, but how far out are you looking at people after they've left the program?
As services are voluntary, people are coming to us, as needed basis, but we're not kind of tracking them for the OBI program ongoing after they exit the program.
Are you connecting them to other programs that they qualify
Oftentimes,
for?
yeah, oftentimes like connecting them, we do a lot of coordination with things like behavioral health intakes, IDD intakes. So yeah, they could be tracked through primarily service coordination and level of care services with the LMHA.
Brian, they could also receive IDD service coordination, in which case a local IDD authority service coordinator would be following up with them
Yes.
periodically.
Also, get people connected, like if they didn't have IDD service coordination, with HCS, we call it divergent squads, if they benefit from that, or just again, connected them to any kind of service coordination that they didn't have before.
That reminds me really quickly, does HHSC do any data on outcomes of the diversion slots? I know we have success sometimes, but anecdotally, a lot of people are prioritized that in the state hospitals and SSLCs.
Diversion slots are you talking about, Sonia?
On the HCS, where you jump to number one
Okay.
when you're in jail or the state hospital. You go to a group home and get arrested.
I just want to make sure I understood your question. Thanks.
Yeah, but does HHSC do any specific collection, like looking at the outcomes of those diversion slots?
We do, I mean, in the sense that, like what happens after they enroll in the program? I mean, we have data through, again, they receive service coordination from the LIDA. And we do, I'm trying to think for those diversion slots. We do, yes, we have a team that tracks. Because they receive enhanced community coordination. I'm thinking of that team very closely tracks data on people, for at least a year post diversion.
And I want to interject to say to the rest of the committee, we're getting very inside baseball here, but HCS stands for Home and Community Services. And it is the most comprehensive form of service coordination on offer in the state of Texas. And therefore it is also the most expensive. So the demand far exceeds the supply, and people who enter the HCS waitlist are on the waitlist for 10 to 15 years on average. And there is a function that HHS and the LIS have access to help someone to get to the front of the 10 to 15-year waitlist, which is what we're talking about here, which is the HCS crisis diversion. And I think to Sonia's point, being that my teams do a vast majority of the HCS crisis diversion applications in Travis County, I would say easily 9 out of 10, if not 99 out of 100, are done for supported housing purposes.
Right.
And so, how long do they, so what tracking them would amount to, like, how long are they staying in the program?
And yes, but we also have data on rates of reinstitutionalization or arrests or hospitalizations that occur especially during that first year we receive.
So
reporting.
This committee get that data, because I think that we would want to probably include some of that in the report.
Yeah, I can look into it.
Awesome.
And I was also just gonna, I feel the need to clarify whenever we're talking about the interest list and the diversion slots, that when we talk about somebody kind of like going to the front of the line, they are not
I just want to be very clear that they are not replacing somebody at the top of the interest list. We have separate processes for releasing slots for people that are on the interest list and have reached the top. And then we use a separate, not a different funding stream, but we essentially use attrition from the program. So people leaving the program is how we fund those like diversion and transition slots. So I just want to be very clear that we're not, that HHS is not, the state of Texas is not like pushing people down the interest list in order to serve these other people. It's kind of done as two separate processes.
Thank you for making that point. It's a much more equitable process than the way I explained it, so.
And I also, because that list is so long, and now we did, I don't remember the year, HCBS, AMH, whenever we did, was that 2015, 2017? Yeah. So home and community-based services for adult mental health. I know a lot of my cases of persons with IDD are going into HCBS, AMH. So do we have
Our partners of behavioral health services.
I think that would be something that would be interesting to look at too.
I agree. Okay, great discussion. I want to do a time check here because we're getting close to lunch and we don't have lunch for people. So we don't want to be stuck between you guys and lunch plans, but we're probably going to go into the lunch hour a bit here. I know online, Ron Lucy is here. I'll go down to the next agenda item from
And
the
Lee,
governor's committee. Yeah.
Jerron had information on crisis services and crisis respite, which did we get to that, Jerron?
No, for the sake of time, I know it wasn't
That's-
originally requested, so we can hold off and do that another time.
Thank
If y'all
you.
are
I
okay with
just
that.
wanted to mention that we can bring them back if
Sure.
people are interested in
That
that.
would be great.
Okay.
Ron, are you online? I don't see him on there, so maybe we'll do that the next. Yep. Okay, so we'll move on. We'll move on to new business. Judge, thank you for being here with us today. We'll kick this over to your part of the agenda. This again is a conversation that started at the last meeting, and we're really grateful to have you guys here to help fill folks in on the work you're doing in Denton County. So I'll turn it over to you.
All right, I guess it's good afternoon in 6 minutes. So my name's Dave Jan. I'm the presiding judge at Denton County Probate Court #1. I've got Colette Solis with me today, also from Denton County. She's my attorney administrator and my guardianship expert, who's also served as a municipal magistrate in a number of jurisdictions. So I thought her expertise in that area might be relevant to those questions that we were asked to come up with. I've been on the Judicial Commission for Mental Health since its founding in 2018. Been a full commissioner since 2020. And I also serve as the probate representative to the Judicial Branch Certification Commission, which is who certifies guardianship programs and maintains the guardianship registration database. Hopefully everybody can hear me okay. It's not going to be death by PowerPoint, although it looks like that. Got a 31 slide presentation. I know it'll take about 2.5 hours. No. This is mainly here to provide a very brief outline of guardianship, what it is, how you get into it, rights, powers, and duties that guardians often have, and those rights that are removed from, we call them protected persons now, as opposed to wards. I've been doing it long enough and I've flipped back and forth because I'm a bad redneck, but I don't mean any disrespect to the folks that we have under the protection of the court. As a little bit of background, the courts that have guardianship jurisdiction in the state of Texas are constitutional county court judges, county court of law judges, and statutory probate court judges. So you've got 3 different levels of the judiciary that potentially have guardianship jurisdiction in the state. As somebody alluded to earlier today, we've got 254 counties. Not everybody does this the same, which makes it incredibly difficult when you're looking at a state with the population that Texas has and the size to craft one-size-fits-all legislation because it doesn't fit. In approximately 148 counties, well, let's go back. 134 counties in the state of Texas have 20,000 people or less. So when you compare
I'm
them
sorry,
to
I
Harris
can't
County.
see it. Is there any way, I'm sorry, is there any way to share it? No?
Sorry, it was up there. I thought it was being shared. All right, we're working on it, but we're not to the first slide yet anyway.
Okay, thank you. Sorry.
So we have roughly 134 counties in the state that have less than 20,000 people. And we've got, ranging from Harris County on down Denton County, where I'm at, it's the seventh largest county in the state, and we're at 1.1 million. So once you start getting below Denton and Collin County, it starts dropping off relatively quickly with resources and assets. You've got about 148 counties where the constitutional county judge administers guardianships or has jurisdiction for that. That individual may or may not be an attorney, which causes other issues. Then you've got in 92 counties, county courts at law who are attorney judges, have probate guardianship jurisdiction. And then you have 14 counties where you have a statutory probate court where all they do is probate, guardianship, mental health. And that's a very specialized jurisdiction. So with that, that's kind of the disparity here. So Mr. Armstrong, when we were talking back and forth, I completely recognize that there are 254 ways of doing business inside the jails as well. And I know somebody's doing it right. I don't know who that is, but when we look at this, there's approximately 52,000 guardianships throughout the state of Texas. About 90% of those are inside your statutory probate court counties, which are generally your 14th largest counties. There's 25 statutory probate court judges. There's 4 in Dallas, 2 in Tarrant County, 2 in Denton County, 1 in Collin County, 5 in Harris County, 1 in Montgomery County, 1 in Galveston County, 2 in Hidalgo County now, and 1 in Cameron County. So there may be 26. I didn't count those up. I haven't looked at it since the start of the year. What we were asked to provide today was kind of what the courtside interactions with people who are under a guardianship are in the jail, talk a little bit about medical consent, decision-making authority, and visitation, who gets access to the protected person. Then we heard a lot about the CCQ today. There's another guardianship registration and database governed by Section 155, Chapter D. I didn't write down the first part of that. So it's Section 155, 151 is where it starts in the government code. And it outlines what this guardianship registration and database is. It says that database has to be provided to DPS, and DPS shall make that available to local law enforcement to search through TLETs. It's my understanding in my research on how that database is actually done is it's a separate search inside of TLETs. It's not going to come up with the criminal history search. It's not going to come up in your CCQ information. It's a separate search that apparently is not widely used. I contacted several of my peers in other counties through their sheriff's office, some individuals I know through the JCMH that administer and run jails. And I got, that's interesting. I'll get back with you. And that was 2 days ago. And I don't have any emails back telling me how they're accessing that. Part of the weakness of the Section 155 database is it doesn't say somebody shall, somebody must, you will. There's no get it done provision in it. It just says it is available, and it doesn't really tell anybody they have to use it. As a probate court judge, I find out when one of my people is being incarcerated through generally my mental health staff running queries through my local jail. Or we have a community diversion coordinator position, which was a pilot program through JCMH, and she'll notify us that we have somebody in our court because our county system is all tied together. That's generally the only way we know we have a protected person incarcerated. We've had a number of cases in the last couple of years where we've had somebody under a guardianship pled out to an offense and been incarcerated. If you look through the presentation, and if you're online and you want this, ask Richard Morgan for it. They've got it. It's disseminatable to anybody who wants it. We don't call it proprietary information, so use it however you feel like. If you have questions, call us. You can also reach us through Richard Morgan or through the JCMH. But my question is, if you're pre conviction, I understand how you're sitting in jail. How do you get convicted? There is nobody that has the authority to enter a criminal plea for you. Because you're not going to find that in a right and duty that I can grant in the state's code. And I'm pretty sure they weren't jury tried. Because if they weren't if they were jury tried, they probably wouldn't be in jail. If they're under a guardianship. So who's entering pleas on these people? And why don't the defense bar know they're under a guardianship? Why don't the district judges know they're under a guardianship? And we ask these questions a lot in our county, so I'm not pointing fingers at anybody, although I'm over here looking at Richard, but that's mainly because I'm just looking that direction. So that's a question that Colette and I had is how are they ending up in jail on convictions when they don't have the right to contract at all, in most cases under a guardianship? Now, individuals under a guardianship are there for incapacity. I don't know if you can see the first slides. We'll finally get to the first slide. Is an adult who, due to a physical or mental condition, is substantially unable to provide food, clothing, or shelter for themselves, care for their own physical health, or manage their own financial affairs. That is a very simple definition of that. We are under a mandate through the estates code that every guardianship application has to be evaluated for a least restrictive alternative to removing your rights. Removing your rights is serious, and it's very hard to restore them once they're removed. So it's an execution of, so to speak, of last resorts before we start pulling rights. Then we have to tailor each order to the person who's being placed under guardianship. In all of the statutory probate courts, you're going to get an order that's 5, 7, 8 pages long and very detailed as to what has been removed, what duties have been granted to somebody else. In some of the smaller counties, you may still be getting a 1-page order that just says rights removed, guardians being granted all powers under the estates code. Not very effective for anybody and not tailored to least restrictive alternatives. But for the last 10 years or so, these orders have been getting very long, very detailed. So with that, incapacity and criminal competency are 2 entirely different standards. They kind of overlap, but they don't. You can be found incapacitated to make decisions, but somehow still be found competent to stand trial because you can have a 3rd grade conversation with your lawyer. Okay. So competency is a legal determination related to whether you can participate in a legal proceeding, particularly in criminal cases. We have many, many people under guardianship who are able to tell their attorney ad litem what they think about guardianship, whether they want one, whether they like the person we're appointing, and they still don't have the ability to go into a grocery store and buy a carton of milk and come out with change. And I use that as an example because that's one of the criteria. It's one of the things that often comes up in court. Could Janie go into the store and leave without getting her money stolen and with what she went in there for? Could you go into a grocery store and buy food you can actually cook and use? You know, do you know how to preserve food to keep it from spoiling and going bad and making you sick? All of these things that we normally consider activities of daily living. None of that has to do with your ability to have a conversation with your attorney, whether or not you're going to process it, whether or not you're going to remember it in 20 minutes or anything else. So, and I talked to the defense bar on this fairly routinely at some of their conferences too with, you all need to look at this. They say, well, we can't do anything our client doesn't tell us to. Well, go read the rules of professional responsibility and recheck yourself for your bar card. I'm retirement eligible, so I can say things like that. And I'm also reelected for the next 4 years. So, if you look on page 6, we start talking about rights that are often removed, managed property, whether real, tangible, intangible, hold and operate, driver's licenses. You'll be surprised the number of individuals that come in and say, hey, we need a guardianship for our aging out IDD child, but they need to be able to drive. Okay, you want them to do the most complex thing a human does that's not a pilot, but they can't make a decision on anything else. Well, they're just gonna drive to work. It's just real close. Okay? The state flower in North Texas is the orange traffic cone and traffic barrel. So although they're going 3 blocks to get to the store to work, well, Wednesday they closed the road. Now they're still trying to go to work and they're on I-35. So, there's a lot of discrepancies with that. Under a guardianship, typically can't make a business decision, can't apply for your own governmental benefits and services. Also, which a lot of times when these individuals are incarcerated and held in jail for a period of time, Medicaid stops, problematic. Because you got to get it back. They can't execute any type of power of attorneys for financial matters, medical matters. So how are you entering plea paperwork to get yourself convicted? See my problem there? There's nothing that says you can't do it and nothing that says how it should be handled. It's completely silent in both codes. Come on down. Is there a need for a guardianship? Maybe. Now this is the question that I believe we're here to address is how does the local jail know there's a guardianship? If the guardian notifies the jail, if the inmate notifies you, most of the time for the inmate to notify you, you're going to have to ask that question. I don't know how many jails actually have that as an intake question. Are you under a guardianship? I know during the time that I did jail magistration and watched some of those questions going on, I didn't hear that one very often. Fortunately, I recognized a lot of our courts. In our court, we've got 1,500 that we monitor on an annual basis. JBCC registration, you got to be running that query. And just because you run the query, it doesn't tell you to notify anybody. So if you're the jail administrator, you're running that query. How do you know what rights that person's had removed? How do you know who has those duties and powers over that individual unless you're contacting the court or the guardian to get a copy of that order? And that should be mandatory, in my opinion. The Supreme Court requires every guardianship to be registered in that central database. I believe they all are now. That requirement came out in, I believe, the 2017 legislative session. Every guardian is required to have an annual report done, and they're required to get letters reissued every year. So in order to get those letters, I know in the statutory courts, everybody has required previous guardians to register before they could get their letters renewed. So I'm confident in saying that in the majority of cases, that's been done.
May I ask a question on the database? Who all has access to it?
Whoever has access to a TLETS terminal.
Really?
And beyond that, I can't answer your question because I don't know the answer. I think I could probably query it somehow. I've never tried. Which is after we started researching this because we were asked to come down here. Being on JBCC, I have lots of questions on the database generally anyway. Sometimes it's user friendly, sometimes it's not. As far as the registration process. So to answer your question, I think the courts probably have access to it through JBCC, but through TLETS, only the law enforcement entities that have those TLETS contracts to do that.
When we first started looking at this, we found 2 statutes, one that said the officer was responsible for running it, and then one says the person in custody is responsible for running the database, and it's to report back to the courts. But we also found at that time the database wasn't working. But from our understanding now, we finally got one the other day. It's been a couple months now, but it is working, and we were able to see the data and what's returned. So, but that's really at this point all we know about it. We are putting in our training to the jails that this database is here and you need to be utilizing this. We've added it to our administrative rules that are going for public comments and so forth as well. So things we're working on with the jails to make sure guardians are found and notified.
And if I would have had time for coming down here, I would have gone over to my sheriff's office and had them run me through it because we've got a very high level of cooperation with our local sheriff for being a civil court. So with that, the database is there. It's been a long time since I was TLET certified as a prosecutor to be able to read those reports. It would be really great if when we run criminal history, it just came up on there and said guardianship. That, I don't see why that's a hard thing to just plug into that. Once we grant a guardianship, we enter that guardianship into the CJS system, the county clerk does. We're required to give a firearms admonishment to every guardian and the ward that they're no longer allowed to own firearms. That's written in the orders now. So if we can put that information in CJS, which is also what generates that TLETS report, I don't see why that's not included on that criminal history. And it may be, and I don't know, because I don't run those reports, but that's another inquiry I'm going to be making pretty quick with my local sheriff, because if it's already in CJS, I don't see why it's not showing up. Protective orders show up on it. So,
Would you say that it should also show up on the CCQ? Or no?
no. Different CCQs administered, as I understand it, by HHSC, is who compiles all that data through the LIDAs and the LMHAs. And since we're putting guardianships into CJS at the county clerk's level, and it's in the JBCC database that DPS has access to me, it seems like that CJS hit ought to come up on the criminal history. And I don't know if it does or doesn't. Sheriff, that might be one of those things that you look at with your guys, and I don't ever recall seeing that in the criminal histories I reviewed as a prosecutor, but I wasn't looking for it either.
I think it should also come up in the public safety recording system, the PSRS for the magistrates. And I've never seen one there.
So with that, if you do get a hit on this and you have this individual in jail and you find out that they're under a guardianship, I think best practices is to contact that court and get a copy of the order. Because whoever the guardian is, they can consent to medications. If you have somebody in jail in need of, medical treatment, or if they're dual diagnosis with mental illness and IDD, you need to maintain those medications for the overall health of the individual, but also so it's not an extra burden on your staff. Because as you have somebody who's incarcerated, who's, slipping more and more into psychosis and the other things, now they're in 1-to-1, single cells, deteriorating even further. And that's a burden on the detention officers, which adds to your retention capabilities and, makes it harder for everybody in there and costs more money. So if they have medications and they're under a guardianship, I would suggest working out some internal procedures inside your jail for how those prescriptions can be obtained. I'm not saying somebody gets to walk in and hand you a bag of unmarked pills, but going through your contract pharmacy, especially if they're insured and they're under Medicaid, there's somebody to pay for those meds. And you're not just relying on your local mental health authority to provide those. And that level of cooperation with a guardian can be really helpful to maintain competency before you end up with somebody in jail for 15, 18, 22 months trying to restore competency because you're able to have medications. If they're under guardianship and they've been found incompetent under 46B, there's a procedure under 46B for which you can seek psychoactive medications while they're incarcerated, awaiting awaiting transfer to the treating hospital. Well, if they're under a 46B, they've already been given prescription medication for their mental health illness, and you have a guardian, ask the guardian if you could administer it in jail. And typically, once people get on medications, it takes about 21 days to restore competency. So if you could restore competency through guardian consent to the medications, why are we in jail for 15 months when you could do that in 2?
That's one of the questions that come up for jail. So they're on medication, whether it be 46B meds or whether it be insulin or something life sustaining. But the guardian says, yes, give it to them. What if the inmate refuses it though? The ward refuses that medication.
They don't have the right to refuse it.
So the jail can hold them down and make them take that medication.
I would discuss that with the guardian.
Okay.
But yes, they do not have the ability to refuse that.
Okay.
Let me phrase that. They have the ability to refuse it. They don't have the choice to refuse it. Now, that's a conversation to have with the guardian on, can we do this? And it may be something as simple as the guardian can come down there and say, Bill, you got to take your meds. I don't want to. Well, you have to. You know, we get people that come back from the state hospital to the jail and refuse meds. And our jail's like, what do we hold them out? You got a court order for medications, you can. So tell you what, they refuse, call me. I'll put the robe on and walk over there and say, remember when I told you you had to take your medications? Yes, sir. Take them. Okay. You know, that could be a whole lot simpler than holding them down just by calling the person who had the authority to tell them. Because most of these individuals are not criminals. They're not the individuals we think of as criminals. They don't want to be criminals. They don't understand why we're here, and they do submit to the authority of the people who have, you know, those duties in that relationship with them. So if they're refusing medications, branch out, be different. Call the guardian, call the court. Say, hey, come down here and tell this guy to take his meds. I know all of my peers, and I don't think any of them would refuse to come over to the jail if you told them, hey, I've got one of your protected people in here. They won't take their meds. You know, can we get a hearing where you tell them to take their meds? Yep. Put them on Zoom. You know, my jail's 3 blocks away. We'll come see you. But we're a little customer service oriented with our sheriff. So you got your powers to the guardian and what they can do. You can take advantage of that and make your life easier in jail. And probably reduce your liability with having contact with those individuals. You probably don't have enough people in your jail under guardianship to where building that personal relationship with the guardian to provide that care is really all that burdensome. You know, I bet even in Harris County, they don't have 15 people in jail under a guardianship. Now, the problem is when you get somebody who comes in who's got an intellectual developmental disability or is chronically mentally ill, severely mentally ill, and they're not under a guardianship, then what do you do? Do you file for, you know, do you make an application as the detention entity for a court initiated guardianship under 1102 of the Estates Code? And then what happens with that? Does the criminal defense attorney make that application, or the prosecutor for that matter? You'll find a lot of people get in their silo and think they can't do things outside the box. And, you know, that's the lack of professional development with how you can serve your population. But if you file that application for an 1102 guardianship, what happens? File that application with the court with probate jurisdiction, that individual is going to get a guardian ad litem appointment. Well, now we've got a civil guardian ad litem interacting in a criminal system where they may or may not have any experience. Smaller county, you've probably got a guy that does everything. Larger county, you've got somebody who only does guardianship and has no idea about the criminal side. I think in our court appointed list, we've got 4 people who do both. And I'm a big county. And I got 4 people on my ad litem list that do criminal law and guardianship. Fortunately, both of my attorney administrators for probate court 1 and probate court 2, and one, Colette's got magistrate experience, and then Byron, who's for court 2, was a criminal defense lawyer as well as a guardianship attorney before we stole him. So we've got, you know, a pretty good database there, and I was a prosecutor. And we've got a reputation for doing things outside the box to try and help these people. So with that, you got to find a guardian ad litem who can know something, who can communicate with the defense attorney, or get appointed as the defense attorney by the criminal court as well. And I've made that phone call too. Hey, I just appointed, you know, so-and-so as a guardian ad litem for a guardianship application for an inmate in your jail. Why don't you appoint her as their defense counsel too? So we've got a, you know, effort running down the same path. A little bit deeper in, after you get past powers related to the guardian, you've got the Ward's Bill of Rights, which is on page 14. Can we pull that up? So if you look at this, these are the rights that we're required to go over with each protected person and their guardian, where you're allowed, the protected person is allowed to still retain as much of their dignity and independence as they can. and to express their needs, wishes, and desires under these Bill of Rights, and the guardian's supposed to adhere to those, and to the extent possible to maintain their activities of daily living, their safety, and their health. And the courts are required to also evaluate those. Now, you ask if they could refuse. They can state their preferences. You know, I don't like Prozac or whatever, you know, I'd rather have this. Well, why? Well, it makes me bloated, makes me feel fat. I don't like it, makes my teeth feel loose. This one gives me, I can't ever pronounce the word. What's the
Tardive dyskinesia.
Yes, tardive dyskinesia, you know, and does this. So I don't like it. I like, you know, this medicine instead. Okay, well, if you'll take this one without fighting with you, and it's in the list and it's prescribed as well, okay, we'll give you that. And sometimes it's as much as when you're in court and they're saying, well, I don't like this, or I don't want to take it. Well, why don't you want to take it? And it's some completely unhinged, irrational thought process. Well, okay, that's not good. So, you know, you can give them those options and those choices, and then work to accommodate them within what suits their best needs of care. Visitation. You need to know who's got the ability to consent for visitation and who can visit. Because if you've got somebody who's got a bad actor in the family who's using this disabled individual to traffic drugs, go in and shoplift and you know, do some of these things, well, the guardian probably doesn't want them around. They don't want them in jail, you know, coming to visit them. You've got a bad actor, you know, ex-spouse coming in. May not want that there. So you need to find out who can have access for visitation as well, and who can consent to that, and get a list of those folks. The only way you'll know that is who's in the order. Let's see where we at. Medications. If you have a guardian appointed, then your normal consent for medical treatment laws, if there's, you know, you become incapacitated, there's nobody to make that decision for you. The consent for medical treatment with no guardian is Texas Health and Safety Code 313-004. That's in the back of the process as well. You've got the 2-doctor rule, which I imagine a lot of jails are using now. If they have somebody in there that's incapacitated and they don't know who the guardian is, then your disputes for a surrogate decision maker. Consent for emergency medical care, Texas Health and Safety Code 773008. And then under guardianship as well, the ability for the guardian to enter a DNR order. If that's something coming into play, you need to know who can do that as well. That can save you a lot of liability and a lot of trauma in your jail and in your jail medical division as well. That's a real fast, me doing a lot of talking, shotgun look, kind of what a guardianship is, with some written references for you. And I brought Colette down here to answer any questions you have. So, not really knowing exactly where this was going to go, we tried to be pretty comprehensive with the law. Additionally, if they're in jail and they're pretty high functioning, is there a need for restoration of their rights? Because there's a lot of guardianships that were entered 10, 12, 15 years ago that wouldn't qualify today under the least restrictive alternative standard. And the next question is, if they're incarcerated in a county different than the county where their guardianship is, let's say they've been convicted and they're in the state prison system, do you need to transfer that guardianship to that county judge down there that has jurisdiction in the area where the prison is? And when you get back to some of these individuals, and I know we had a lot of testimony earlier in the public comments about individuals who were in jail. And if you don't have any family members willing to step up and serve as a guardian, some counties operate public guardianship programs. But if you have an individual who is chronically involved in altercations, criminal trespass settings, petty theft, and, you know, who do you find to accept the liability of being a guardian? And unfortunately, the reality of it is sometimes you can't. And as a court, we don't have anybody to provide help for some of these individuals, even though they need it. We can't provide it. Because we can't make anybody be a guardian. And it would be really nice if we could, but we can't. So with that, any questions? That was a lot kind of thrown all out there at you.
I had a quick question, Judge. In terms of liability, we see a lot, as the local IDD authority, we see a lot of folks coming to us with guardianships that are expired. And usually we find that the expiration is due to economic need. We exercise the discretion to still honor an expired guardianship. Is that?
I'm confused as to how it expires due to economic need.
Because there's a fee for renewal.
Yeah, it's like $14 to get your letters.
I thought it was like $50.
File an affidavit of indigency.
Okay.
And then they don't have to pay the fee.
Okay.
And the guardianship doesn't, their letters may be expired.
But the guardianship's not expired.
Right, unless
That's what
there's been a
I'm sure.
court order
Okay.
modifying and restoring rights, that person is still legally incapacitated.
That's what I wanted to get crystal clear on. Thank you so much.
So to make all the courts happy, and especially the county clerks, if you have somebody whose letters are expired because of indigency, and that's what they're telling you, and they're collecting a governmental benefit for indigency, you know, SNAP, Medicaid, whatever it is, or the protected persons under, once it's all granted, and they're, you know, indigent, have them file a chapter 145 affidavit of indigency under the rules of civil procedure, get the form, they're online, that has the right information on it, include a copy of their SNAP benefit or their Medicaid eligibility, and it's automatic. And then every year, the guardians have to submit an annual report of the person to the court. All of the courts are supposed to be checking those. If you're a statutory probate court, you've got a court staff that checks that. If you're, you know, the county judge in Loving County, you probably don't have anybody doing that. You know, you may not have anybody under guardianship in Loving County either. I'd move them to the next county because it's not real big. But so with that, once they file that annual report, that's due within 60 days of the end of the reporting year. And then their guardianship letters are good for 4 months beyond the annual accounting year or reporting year. So you've got a pretty good grace window in there. So if you're having people, especially in Travis County, who are showing up without letters, Judge Herman and Judge Chu's staff ought to be all over that with them. And if they're not, let them know. You know, call down there and talk to their guardianship investigator and say, hey, I got this person down here and they're telling me their letters are expired because they're indigent. And I'm willing to bet that they'll handle that. I would be amazingly surprised if they didn't get that taken care of for you.
Great, thank you.
At least in the statutory probate courts.
And those affidavit of indigencies are usually available at the clerk's office. And if not, they're online.
Yes, ma'am.
So I'm going to test something. Tell me if I've got this right. The court that would have natural jurisdiction when a person does not yet have a guardian, but a person would like to approach the court and petition for a guardianship is the court of the individual's residence.
It's the county of their residence?
Yes.
Yes.
And so what do you say to like a very small rural court that when approached says, we don't do that?
That they don't do guardianships?
Correct.
I don't want to sound we get in trouble for. Report them to the state and to the judicial council of ethics. Exercising guardianship jurisdiction is not optional if it's the jurisdiction of your court.
Has a petition been filed and then denied or dismissed, or is it just a conversation?
I think it's more, informal, like
I would
local
file
identity
it.
authority would call and say, who should I talk to about guardianship? And they say, we don't do that.
Now, whether or not they're doing an 1102 referral process goes back to you've got roughly 148 counties where you've got, you know, potentially a non-attorney county court judge. And I've got a bunch of those that call me routinely or email me because I've made myself available for that as somebody who has a staff that I can say, well, I got somebody that will help you with that. Because at the end of the day, we got to service the needs for these individuals one way or the other. File your application, and right behind your application, file a request for the appointment of a statutory probate court judge to the case. That'll make everybody not happy. Because there's only 25 of us in the state. We are already busy in our own court. There's only a handful of visiting judges for probate. But in a constitutional county court county who doesn't have a county court of law of probate jurisdiction, you can request a statutory probate court judge. Now, whether they'll grant that or not, because they don't want to pay for that, because that's $800 a day. But if they don't want to do it, file that application for a statutory probate court judge and send a copy of it to Judge Herman. Because Judge Herman is routinely known in the state of Texas for saying, who's not doing that? Give me their name and I'll call
And on a related note, is it accurate to say that the court can develop its own local rules about whether a self-represented person can approach the court and petition? Or
I'm going to ask you, one, is your microphone on? Because I don't know if the folks online can hear you. Right there. Oh, no. All right. So the question was, can a pro se person approach the court for a court initiated guardianship and make that application? You can make the referral to the court as a pro se party for a court initiated guardianship. Because you're not representing anybody. You're not taking on a fiduciary role at that point. As a pro se party, you can represent yourself. You cannot represent anybody else's interest. So you typically, well, you should not be able to be appointed as a guardian without legal counsel because you're acting in a fiduciary capacity over somebody else's person or their property. Okay. So there's a requirement there that you be represented by counsel. You can make the 1102 referral to the court. The court will or shall appoint a guardian ad litem to then go and conduct an investigation or conduct the investigation themselves. I have court investigators who go out and do that. I also have a whole, corral full of guardian ad litems that I can appoint. Yet again, that may not be the case out in Ward and Reeves County, or any out in the hinterlands. So you file the application, the court has to take some action on that. You're filing an 1102 referral. They can't just say, yeah, we don't do that. So, but if that's followed up with a request for appointment of statutory probate court judge. There's not enough of us to go around, but I do tons of hearings and I've got cases all around the state of Texas and I do a lot of hearings on Zoom in, outerlying counties.
so what do you say to a family member that would like to petition for guardianship and cannot afford counsel?
North Texas Legal Services is the public kind of entity up where I'm at. I know they have those throughout. Contact the Bar Association. There may be somebody that'll help you out pro bono in a small county.
I would also say you may want to cover your ears, send an 1102. And if you want an example of what that looks like, if you go to the Denton County Probate Court website, we actually have it in Word and PDF that it can be filled out. You could just mark out the Denton County stuff at the top and fill it out and send it to the court. Because what happens when you send it to the court is the law says they have to appoint a guardian ad litem. And so that's a court cost, that's a county cost. Okay, so which is why, cover your ears, right? But if it's an indigent family with someone who really needs a guardianship and they have no way to get one, they need to let the local court with jurisdiction know there is an incapacitated person in this county that needs your help. The law then says the court has to act on it by appointing a guardian ad litem. So there's no fee to anyone to send an 1102 referral. The court has to act whether, or not. And that guardian ad litem that is appointed, at least in Denton County, has an exhaustive list of powers available to them, including the ability to obtain a guardian, to file any necessary paperwork, to file any pleadings. So if we appoint a guardian ad litem, they go out, they sometimes come up and file a temporary, which is an emergency guardianship application that has to be, heard within 10 days because the situation is so dire. Sometimes, a regular guardianship, sometimes they come back and say this person doesn't need a guardian. But the way, if you can't find anyone to help you and you're truly indigent, there's truly a need to send an 1102.
Now, getting back to the resource question, if you're inside, Texas got what, 36 million people now, roughly. around there. 25 million of those individuals live in the Texas Triangle, from Denton to San Antonio and over to Houston and, the counties adjacent to that corridor. If you're a county in that corridor, you've got attorneys, you've got courts that are probably administered by either county court of law judges or statutory probate court judges, overwhelmingly, I would think, for your probate jurisdiction, or a combination of constitutional county courts and county courts of law in the same county. If you're outside of that, you're getting into those counties where, you got less than 20,000 people. You may not even have an attorney in your county that's not the part-time county attorney. And that's the reality of it. I got friends out in West Texas and they're like, man, you ought to come out here. You can make a killing. So, well, I could, but I'd have to drive 1,000 miles every day to hit my courts. You got district courts out there that have a 300-mile circuit between their courthouses, and their attorneys have a 300-mile circuit too. So, it's a resource thing as well. I know part of the discussion earlier was on IDD commitments into the state supported living center. And I kept hearing those called IDD forensic commitments. And I need somebody to explain what a forensic commitment is for an IDD person to a state supported living center.
Explain.
Because we do the IDD commitments in our court and we've never referred to them as forensic commitments.
No, it probably wouldn't be. It's for folks who have been charged with a crime, determined to have IDD, and either the charges are still pending against the person, but they have been determined incompetent to stand trial. Then the court has the option to do a forensic commitment to the SSLC. Does that make sense?
It does.
There's sort of other routes too, but that would be the most common one.
And then they would send those to us more than likely. We don't get many of those in depth.
Those can, then the forensic commitment can transition into a civil commitment and often does. But the person can be forensically committed to one of the two forensic state supported living centers, Mejia and San Angelo, for up to the maximum period that the criminal sentence would be.
Any other questions?
Yes. So the chair of the Governors Committee on Disabilities, and I chair their subcommittee on guardianship. We have been inundated for, I can't even remember how long. But every meeting we have every quarter, we have people calling public comment and there just seems to be a saturation of fraudulent guardianships out there. And people are being basically kidnapped by these guardianships, and they're cut off from their family members, and all of these horrible things are happening. So there's some collusion going on somewhere for all this to happen. I'm not on anybody's payroll, so I'm
gonna sound a lot like my presiding judge, Judge Herman. I hear things like that and I don't get specific instances to actually go and look at.
Right.
And I know the judges, I know every judge that's a statutory probate court judge in the state of Texas. And they are administering, like I said, 90% of these cases.
Yes.
And I can, without a doubt, feel very confident in saying it's not coming from a statutory probate court in the
Yes.
state of Texas.
Yeah, I don't doubt that.
And since that movie came out on Netflix, I spent half of my public appearances talking about since you're on that commission, it's every statutory probate court in the state of Texas, all 25 of them, as a judge, they've got a court coordinator, an administrative assistant, a court auditor, and a guardianship investigator, or like in Dallas, a guardianship court investigator detachment that's a separate entity that serves all three courts. They have the attorney ad litem, the safeguards in place to prevent a fraudulent guardianship. You've got an attorney ad litem who's appointed to that individual the minute you get an application. They're either paid by the county or paid from the estate of the guardian. You've got the court investigator who has to go out and review that case independently, who works straight for the judge. The judge has a $500,000 bond that I'm personally liable for if I mismanage an estate due to negligence. So when I hear that, I'm like, you got to bring me, if somebody tells you that, say, I want a name and I want a case number.
Yes, and we we began doing that a lot, offline.
Yeah.
And trying to send them to the right authority to help fix it. And Judge Herman was helpful to me when we first started our subcommittee. He's great. But I just, I'm gonna ask you to come and speak to our committee. If you don't mind, please.
Oh, great.
Yes.
It's,
Yes.
but it is, when I hear that, and I know that in those statutory probate courts, what the protocols are, what the procedures are, and like I said, it's not like I'm one of 500 district court judges. I'm one of 25 statutory probate court judges. We know each other.
Right.
We talk to each other, we meet with each other once a year. If you're one of the judges in North Texas, we meet with each other probably once every 6 months with all of us. And it's, when you hear that, ask for a case, ask for a name, and get a cause number in a court. And I'm confident that what you will find out is you have an unhappy family member that did not get their way.
I'm sure that's.
And as an example, we had a case in Denton not too long ago where a disgruntled family member picked up the protected person and took off. We had a local police officer interact with that individual while they had the protected person, and that officer refused to give the location to the guardian. That's aiding and abetting a kidnapping, because you don't have the right to withhold their location from that. And to come back to what you said, Mr. Armstrong, earlier, well, what if they said they didn't want to take the medications? Well, that person who's under the court's protection doesn't have the legal right to refuse to go where they're supposed to go. And that individual ended up taking that person out of state. And while our local entity was backpedaling, my question was, have you called the FBI yet?
Yeah.
And they're like, no. And it's like, well, get on it.
Well, I helped one
So-
family get a reversal, and because they went before the judge, and it was a smaller rural county. And they wanted like 2 specific rights protected, and that's it. But that judge sat there and with his pen changed everything and took away all the rights for that individual.
There are some very good appellate opinions come out that are in Tarrant County in the last 6 years, 8 years or so on refusal to grant a guardianship and granting a guardianship. I know everybody involved in them, and they're good cases. They were written up very well by the Fort Worth Court of Appeals. I think they're the 2nd District Court of Appeals down there. That provide some good opinions on that. I could probably have Colette look those up for you. But it is.
Elizabeth Hart on our committee too.
Yeah, but it is, and you get 254 counties.
Yes.
Even amongst the statutory probate court judges, they look at things differently.
Yes.
Now, I got my counterpart in Denton County, replaced me as the associate judge when I went to a criminal bench. He had been in my court for years. We've known each other for almost 20 years. We make a very, very determined effort to be the same. We swap court reporters back and forth so that they can grade us on whether we're behaving correctly or not, and whether we're, looking at the same things in court. But we also, our court's in an old warehouse, telecommunications center. So his office is 3 doors down from mine. I don't have to change buildings. I don't have to change courtrooms. All I got to do is get up and walk down the hall. And we try very, very hard for our staffs to be integrated and working as a cohesive team. That is not the case everywhere. And I'm not saying it's good or bad. In some places, El Paso County, you got 1 court on the 2nd floor and 1 court on the 11th floor. They're not talking to each other because it's structurally hard. And I like both judges out there. They got great staffs. I've been out there and visited them, but it is, you get different stuff in different counties. And when you have judges who do probate or guardianship, they'll do a guardianship case twice a year or once a year.
Right.
Where I'm doing 300 a year. And there's a different, Harris County's doing 5,000.
And those that are doing the one, they're not current with the laws even. Well, that case I was talking about that we got it reversed. When I was talking with that, the family's attorney that all this happened in front of, that woman been doing these guardianship cases for 30 years, but she didn't know what an ABLE account was. And I said,
You only know what you got experience with.
it's a thing. Go to the website.
Or Art Trust, or, you know, we don't do guardianships over minors because or guardianships of the person over minors. Because I'm mandated by law to look at the least restrictive alternative. What's a least restrictive alternative to a guardianship of a minor? A conservatorship in the district court. Because here's a catch. If I put you under guardianship as a minor, you turn 18, you go down to academy and try to buy a shotgun, guess what you've got? A CJS hit because you're under a guardianship. Then they've got to come to court to get their rights restored when it should have been automatic because the system doesn't self-regulate. Get one of those phone calls as a judge from an irate person. You know, they were put under a guardianship when they were 6. You know, conversely, when parents want to come in and fight over their IDD child in a bitter divorce and try to bring all their family law stuff into probate court, the needs of the ward, the protected person, are best interest of the ward. Well, that's not to continue being in the tug of war with your parents who can't get along because they're still mad at each other from 10 years of divorce court. So I just smile and say, which third-party guardian would you like to have?
Yes.
You all can either grow up and act like you should, or we'll solve your problem for you.
Yes.
But, so.
I'm just curious about how we could get everybody on the same page more. And I know that's not something we can resolve today.
Smaller states.
Yeah, that's true.
But, and not,
Thank you.
We have ideas.
yeah, we got lots of ideas.
Well, I'm wanting to hear them because we're trying to compose a recommendation for.
But I mean, anybody that's involved in the process for trying to advance the ball in the state of Texas for any of this, it's 254 counties, massively different resources. There's counties in West Texas where your closest mental health hospital is Carlsbad, New Mexico. I mean, think about that.
Yes.
And then you get statutes that are so helpful. It says, well, if you've been picked up on an emergency detention for mental health, you can file your application where they were found, where they reside, or where they're being treated. And everybody starts fighting to get out from under being financially responsible for that. I want a statute that says you will file X. Priority 1, 2, 3. If you have one of my residents and you file a case anywhere in the state of Texas and you send me a bill for it, you know, when you file your case and I know about it, I'm going to reach out and take it because I do everything by Zoom. Every mental health case we do is remote. So I'm going to pull it all in. I don't want to pay fees for something that we do. And all of our treating hospitals in the surrounding counties know that. And we're faster too. But, you know, you're looking at regional, you know, mental health courts. You're looking at, I believe the law passed for a regional associate judge for guardianships in the last session or the session before that. You know how many of those are on the state? Because you'd have an associate judge working for 3 or 4 or 5 different counties, with every judge involved in that having a different process of doing it, instead of saying, okay, not my specialty, we've now hired you to do it and running with it. But that's, you know, to the law enforcement side of it, wouldn't it be nice to have one guy in 5 counties that's the guardianship mental health guy or gal?
Yeah. 2 sessions ago, we had a proposal for a specialized court for guardianship, which would solve a lot of this stuff that's happening in those rural counties. But it didn't pass.
It's because those counties would have to contribute to that fund. But
they have more cows than they do people.
So how many people did you say are under guardianship?
approximately 52,000.
And we don't have a number of how many people in county jails are under guardianship?
I do not.
That was one of the things we've talked about is are we tracking that? If not, how can we?
And do we have that?
And that goes back to, I heard somebody say that you all get a count of who comes back with a positive query. And going back to the conversation that we had at the very start on the reporting of the CCQ, that statute needs to be completely rewritten to provide direct, specific guidance as to who is to be, whoever runs that report, who they should disseminate it to. And that needs to be you shall disseminate, not the agency can disclose. It needs to be a you shall disseminate.
Yeah.
Because in all these counties, I guarantee you, the county sheriff knows the county judge who's got probate jurisdiction. And he knows the county attorney and the district attorney.
The JVCC guardianship search should be a shall.
Yes.
It should not be it's available to, it should.
And that should be a shell as well. And you know what? Every district attorney's office in the state of Texas and county attorney's office in the state of Texas can run TLETS reports for their department. Make it a shell for them to run.
What is the CC part of JBCC?
Certification Commission.
Thank you.
It's run by Ron Morgan. Any relation to you, Richard?
Not as far as I know.
All right.
And I, as a court staff, have reached out to the JVCC to try to get information on guardianship and haven't gotten a response.
But, you know, saying the sheriff should disseminate to the district attorney when the district attorney can run TLETS reports too. Shell. Every prosecutor shell.
This has been a great discussion. I know a lot of us have taken notes about things. I was thinking about even the intake screening form subcommittee, looking at the possibility of adding questions around guardianship. That could be another, redundancy in the system to help identify those things. So lots of great information. Appreciate you both being here. Thank y'all. Any other questions?
Oh, Sonia,
Sonia, we're gonna give you a time call.
Oh, okay, well, I think you sort of just answered one of them, but going back to what Aaron had brought up, I mean, so the two things. We get a lot of people, suddenly person is incarcerated, person clearly meets criteria for a guardian. And families are desperate to be able to have conversations with the jail, the providers, the attorneys, everyone. And many of them are indigent. So my understanding is file that 1102.
That you can file an 1102 letter and sometimes we get them from, I believe it's the social worker at the jail. I won't say that we do have to look at 1102 and sometimes there is not anything you could do, right? So we've had an 1102 from the jail that ended up in a successful guardianship for an elderly man who had, dementia. And as soon as he was going to be released, he was going to go back to wandering the neighborhood, petty theft at the convenience store, because he would walk in and grab something and not paying for it because he didn't have that understanding that he still needed it, right? He was someone that could be helped by being in our local guardianship program. On the flip side, if you have somebody who is, going to be incarcerated for whatever period of time, what is there that a guardian can do? A guardianship's not already established. A guardian doesn't have the authority to negotiate a plea deal. They don't have the authority to act in their criminal case. They're not going to have the authority to have attorney-client privilege conversations in a criminal case. Those are not things, that we're able to do in a guardianship. So we do have to look at it. The guardian ad litem that gets appointed to go out and research that and say, is a guardianship needed, has a whole lot to look at to see if it's workable. There are people who are eligible for a guardianship or who, that we can't help. So, but yes, you can always send the 1102 and then the court has the due diligence to do the research.
So then, and Judge Jan and I have had this conversation. So in speaking, because like when you give the example of the man who's just going to go out and do this stuff. So unless the guardian has a placement, guardian really can't do it. So it can't.
Right. In his instance, the guardian was our local guardianship program, who then has, the resources to qualify him for services and be able to obtain placement. But yeah.
So, and we've had this even just very recently on one of our highest utilizers in Travis County, where finally we get a guardian and it's through the organization. And now we're not even doing a hearing when they say we don't want to do it anymore because he elopes. And he cannot, he essentially lives in our jail. If you pull him up on the district clerk, the majority of his time in the last 10 years, 20 years has been in jail, not out. So that is something we've had this conversation. I know you said you're going to take it to the JDCC, but I think that we're running into that more and more. And if we look at the interim charges, I think I have it printed up from the Senate and the House. Both said that they were trying to target SMI, high acuity, unhoused, cycling through, and I think that this population, there is a population within that target that qualifies for guardianship, but there's not going to be a successful guardianship because as it stands, there's no placement.
And that's the problem that you face with, part of this population is they won't accept the help. They're not capable of accepting the help. And there's no family member that's willing to step up and do it. And there's no paid professional guardian who's licensed, certified, and insured who will take that liability for some of these individuals. And that's really what it is. It's liability. And, and the courts as well, is there's just some folks that you can't help because there's nowhere to place them. And Texas for mental health needs is a crisis commitment state. So as soon as you're no longer in crisis, which is not cured, it's not treated, it's not, stable, it's no longer in crisis. And when you leave the facility, you're going to be back in crisis in 24, 48 hours, but you're no longer qualified to stay there. Even under a court-ordered assisted outpatient treatment program, you still got to have a housing component somewhere to be successful in those cases. And there is, this is a big part of your advocacy is where is this intermediate step down? And oh, by the way, even if it's there, what's the legal authority to make you stay there when the Supreme Court said can only detain somebody in a non-criminal setting if they're, in crisis or meet the IDD commitment criteria to a state supported living center, which for everybody who's advocating for more beds in the state supported living center, there's somebody else advocating to shut it down. And if you don't think that there's a financial interest in people that want to shut those schools down, look at where they are, look at the land they're on, and then go look for the developer that wants to build on. I'll say the hard part out loud. They want to take that property to put something on it. And it's not being driven by disability rights, who has their, their own things that they don't like about it. But the people who are really advocating and have the money to get in the legislature and advocate for reduction of those facilities, they're builders. My school's on 150 acres in the middle of Denton on nice rolling hills.
So, but then is that something that we can try to, because I think the Supreme Court is more motivated to address this when we have data showing, oh, all these people were under a guardianship, but it was dropped because it's not a successful guardianship. We can't do it.
I don't know that anybody has that particular data.
But I think that's something that we could start looking, because we all know it. Everybody's sitting in the room going.
We can think of a couple of cases where it just didn't work, no matter how bad we wanted it to.
Right.
So.
And even here, Judge Herman, a lot of times their court doesn't even begin the process. They won't even look at the application because they're already like, we can't do anything with this.
It's because they've looked at it repetitively before.
Right, exactly. So I just think if we can capture that. Also, just before we end this conversation, so now are all jails running that query?
It's not a required query to run unless, like I said, there's two different statutes. It says the arresting officer and the one that says the detaining facility. So we have sent a TA memo to all jails about these queries and that they are there and they should be ran. So are they? No, not yet. Are we working on that? Yes.
And then I don't know how your memo read, but you don't want these people in your jail. So you should run it. And then will they report it to you monthly? So I can do an open record.
It is not reported at this time. Like I said, it's something it's new. It's not new. It's been here forever, but it's new to the jails. They weren't aware of this. So we're making them aware of it. We're putting it on training at our training conferences. It is something that we'll be inspecting and talking to them about and telling them they have to run these. But it's not a query that has to be ran on every person that comes into jail. It's only if you are aware of them having a guardian. So that's the issue there.
And that's where, because it gets reported, guardianship of the person gets reported to CJS. I don't see why it doesn't come up on TLETs just like a warrant or like a, protective order. That's just, that ought to be a simple,
And I was talking quietly when you were going through the presentation, and I'll look to set something up with Freeman Martin and see if we can't get that attached as an automatic.
Because
automated like the CCQ is and everything else. But
that's just one of those things that's to me that it shows you everything else that's entered in CJS. That's where your protective orders and all that get entered. That ought to be a toggle flip.
So yeah, somebody probably just side of it, yes, but we can get that automated.
And then you have to educate people as to what that meant.
But why would we?
I would love to continue some of these conversations offline. great information today. I appreciate you coming
Absolutely.
very much.
Yes. Thank you for having us.
Yeah, thank you all so much. All right, so I'm told there is no other business.
Wait, I have a question.
Sonia.
But why wouldn't we attach it also to a CCQ? Because you could show up in a jail, not have any history.
That's what I just said. I was
Oh,
gonna,
that's what you're saying.
I'm gonna-
Okay, I thought you were, okay.
I'll get
I'm
it,
sorry, I thought you were
get them
doing
to
the.
flip that switch.
Yeah,
Yes. So the date for the next meeting is July 8th. All right, so no further business.
Just one quick reminder, everybody, and we've heard it online there as well. I know there was concerns. Committees haven't gotten together as well as they need to and some of those types of things. But it is important to remember this is a reporting year for us. If members of this advisory committee want things in that report, we're gonna need to have them collected and put together by midsummer. And again, I'm going back to the last reporting process. I know there was a lot of concerns aired about the report not having enough meat and potatoes and enough detail to specifically describe a lot of key issues that are out there. So I just want to put a reminder out, if you're subcommittee chair with specific responsibilities, let's get that information, start getting your groups together, get that gathered so we can go to work on making sure our report is what it needs to have.
Thank you,
And
Sharon.
one more question. Sorry, y'all, but.
A lot of us have 1 o'clock meetings. So.
Yes, I get that, but just quickly, so is a jail able to say how much money roughly they're spending? Like, what are the resources needed to house their IDD population? No.
They don't track that, no.
Do they track how many people are in solitary? Yes, but can they break that down to IDD? No. Could they try?
So we can continue this conversation at another time,
Yeah,
but we need to wrap this up.
I think that when the legislators see what's really happening and we missed that opportunity, they didn't put in the auditor's report. We haven't talked about what's happening in the jails and they don't even know what IDD is. So as soon as I say the R word, suddenly they're freaking out, but it's the end of session. So I'm just saying, like, if we said, wow, we have all these people with IDD and they're in solitary. And then you listen to the moms showing up and describing what's happening, which, by the way, I was crying. I'm about to cry just talking about it. So I think that in that report, we have to convey.
Absolutely.
Let's work on this in your
I think that's what the sheriff was saying when he mentioned that we need to draft.
I'm just saying, if the jails, states want to go, you know what, how do we compile how many people are in solitary?
Motion to adjourn. Second. Thank you. We're adjourned.